Okay. So last class we have discussed about dravya guna and the importance of dravya guna and dravya guna, the role of dravya guna subject in our clinical practice. Okay. So moreover, it is a very clinical branch rather than a non-clinical subject. Okay. So in our curriculum, as a teacher of dravya guna, you are considered as a non-clinical teacher. So they won't give you a clinical uh, clinics, or else they won't allow you to see the patients in college. But actually, if you are good in Dravya, if you are master in Dravya, you are the best practitioner. Okay, I can say you are the best practitioners. So many aspects of Dravya will evolve in detail about their utility and their results in a patient. So it will give you a very good experience in clinical practice. Okay. So whatever may be the subject, as a graduate of either the BMS graduates or MD graduates, your prime function is to do clinical practice. After PG, before without PG, so your main concern is to go for a clinical practice. So that is your aim. So next MD teaching pharmacy, it's second option. First option is clinical practice. Then you can think of other things. Okay. So we'll start Dravya. So Dravya, the word is of derived of two words, Dravya and Guna. Okay. So what is Dravya? We are already studied in Padartha Vijnana. Yatrashritaha karmagunaha karanam samvai yattad Dravya. Charaka Sutrasthana, first chapter. So Dravya is the one which gives ashraya to the karma and guna. We are in detail studied about Dravya in Padartha Vijnana. Whatever may be in the universe is Dravya. Okay. So anything in the universe is Dravya. So it has, Dravya has two gunas, karma and as well as guna. Dravya has two characters. It has guna and karma. That which is having guna and karma is called as Dravya. When come to Dravya guna, so here Dravya means an herb, or a medicine, or a plant, or shrub, or a plant. Okay. The medicine which we are using in our clinical practice, so for mitigating the disease, we are advised to the patient to mitigate the disease is called as Dravya. Here in the classification, we have major two classification of Dravyas. One is Ahara Dravya and one more is Aushadha Dravya. Okay, so we use Dravya in Ahara, the one thing. Dravya has an Ahara, and another one thing is Dravya has an Aushadha. So major two classification of Dravya, one is Ahara, the second one is Aushadha. Okay, so when come to the nomenclature of drugs, nomenclature of the herbs, so how we have to give the names. So in our nomenclature for a newborn baby, we have so many factors to consider. One is according to the Jyotisha, according to the Nakshatra, according to the Rashi. So we will name the baby. So like that in Dravya, we have some protocols how to name the Dravyas. How these Dravyas has naming till today. Okay, first one is Rudanam. So from the Rudi, it has started. So for example, Atarushaka, Guduchi, Tuntuka. So this will come as a Rudi. Okay. From many years, we are using these drugs. Simply, we are giving the names and we are using these names in our routine life. So this is Rudana. So next one is Prabhav. So based on the Aushadhi Prabhava, we have named some drugs. So for example, Krimigna, okay, Ayamara, okay, Nidrari. Nidrari is Kirata Tikta, Kushtagni, Bakuchi, Krimigna, Shirisha. Okay, so like that. So based on the function of a drug, we are given the name, that is because of Prabhava. From Prabhava, we are given a names to the drugs. First one is Ruda, Ruda Nama. Second one is based on the Prabhava, we are giving the name to the drugs. Third one is Deshokta. So that drug is taken from the particular Desha, that's why we are giving the name of the Desha. For example, Ramata. So it is taken from the Ramata Desha. So Pakistan, Afghanistan borders. So that's Ramata. So that area is called as Ramata. So Ramata is a synonym of Hingu. Okay. So Ingu Niryasa. So Ingu is the synonym of Ramata. And then Magadi. Pipali. The name Pipali is Magadi. Vaidehi. Like that. So based on the Desha also we are given the names of the drug. So particular desha we have taken the drug. That's where the same name will be given to the drug. First one is Ruda, second one is based on Prabhava, third one is based on Desha. Deshokta. So third is Lanchana. Okay. So what is our Lanchana, Indian Lanchana of India? So we have Lanchana. Ashoka Chakra has taken as a Lanchana. Simha, four Simhas with Ashoka Chakra is the Lanchana of India. Okay, so like that, in olden days, every king, every constituency having their own lanchana. So based on that, also they are given the names. Otherwise, that particular kingdom has taken this particular herb has their lanchana. Otherwise, it may be vice versa. So they are giving the name. Okay, so Pancharajapala. Pancharajapala is Patola. So Patola, the name is because of his lanchana. Pancharaja Fal. Chitra Tandula, Vidanga. Vidanga is called as Chitra Tandula. It is also based on Lanchana. Pancharajafala is Patola, Chitra Tandula is Vidanga. So based on Lanchana also they are given the names for the drugs. Next is based on Upama. Based on Upama, Panchangula. Panchangula is Erenda. Simhasya. Simhasya is which drug is called as Simhasya, which is Shrestha Raktapittahara. Raktapittahara Shrestha. Vasa. Vasa flowers is looks like that of the mouth of a Simha. Okay, Vasa flowers looks like that of a mouth of Simha. That's why it's called as Simhasya. Gojiva Patra. Gojiva. So it looks like that of the tongue of a go. That's why it's called as Gojiva. Gojiva Patra we used in Lekana, Shalakya. Gojiva Patra, Shefalika Patra. Used for Lekana purpose. So Gojiva. So based on Upama also we will give name to the plant. Next, based on Virya. So some drugs we can call as Ushana. So Ushana is Shunti. So because of its hot potency, we are given the names Ushana for Shunti. And Shita. Shita is Bala. So Bala is called as Shita. Only Ushna. Ushna is Maricha. Ushana is Shunti. Ushna is Maricha. Okay. So next, remaining things are we don't have any particular reason to call the drug name like that. It's called as Itara Etara. So first one, we are named the drugs based on the Ruda Rama. Next is Prabhava. Third is Deshokta. Fourth is based on the Lanchana. Fifth is Upama. Sixth, Itara Etara. Okay, so how the nomenclature of the drugs done is based on these criteria. Okay. So you know about Ashtanga of Ayurveda. So Kaya, Bala, Graha, Jatrodva, like that. In Ashtanga Sangraha, Ashtanga Hridaya, Charaka Samhita, Sishta Samhita. So we followed one pattern. So we start from Kaya, Bala, Graha, like that. But Rajanigantu is the first Nigantu. Their name, they are given first place for Dravya. Dravya is the first Anga of Ayurveda, according to Rajanigantu. So it's a PGD point, we should note down. So in which Nigantu or in which Samhita, they are given a first place for Dravya Guda. So Rajanigantu is the one they are given a first place for Dravya. Dravya Gatakas. When come to Dravya Gatakas, what are Dravya Gatakas? So Rasaguna, Virya, Vipaka and Prabhava. These are all Dravya Panchaka or Dravya Gataka. Okay, Rasaguna, Virya, Vipaka and Prabhava are called as Dravya Gatakas. Okay, so Dravya Gataka or Dravya Panchaka, Rasaguna, Virya, Vipaka and Prabhava. Dravya Gataka, Dravya Panchaka. So then Sapta Padarthas of Dravya. So Sapta Padarthas are Dravya, Guna, Rasa, Virya, Vipaka, Prabhava and Karma. So Karma no ಸೇರಿಸ್ಕೊಂತಂದ್ರೆ Dravya no ಸೇರಿಸ್ಕೊಂತಂದ್ರೆ it becomes 7. Okay. So Dravya Namakarana is over based on Virya and all. Dravya Pradhanyatva. So why Dravya is important? So ಇದರಲ್ಲಿ ನಮ್ಗೆ one question ಕೇಳಿದ್ದಾರೆ based on ನಾಗಾರ್ಜುನ. So Bahutvat, Yogyatvat, Aneka Vidakalpanat, Bahuguna Sampannat. This is the Charaka version. So then Sushruta, why it is important? Because of it has a multiple actions. You can make multiple preparations. So very much available. Without Dravya, we cannot do anything. Without Dravya, we cannot assist Rasa, we cannot assist Vidya, we cannot assist Vipaka. So Dravya is the predominant. Why Dravya is superior? Without Dravya, we cannot do anything. So Dravya is important. Without foundation, we cannot build a house. So like that, Dravya is important. So the same thing is given by Acharya Charaka. So in the explanation, in the extension of this Charaka words, Sushruta has also given some of the things add on to Dravya. But they will ask you the version of Nagarjuna. So apart from Charaka and Sushruta, Nagarjuna has added another 3 extra features for Dravya. So it is very important. So you can mark it out. These 3. Vikalpa Samarthyat, Pratigata Samarthyat. Vikalpa Samarthyat, Pratigata Samarthyat. Vikalpa Samarthya and Pratigata Samarthya. These 2 you can make underline. I will share you the notes, but make it underline of these 2 features, Vikalpa Samarthya and as well as Pratigata Samarthya. So Dravya is important because of Bhakalpa, Bhaguna Sampanna. These features are very common. So in APGT last 12 to 15 years, they're asking about, according to Nagarjuna, Dravya is superior because. They will not ask you about Charakas or Sushrutas. According to Nagarjuna, Dravya is superior because of it, Vikalpa Samarthya and Pratigata Samarthya. Okay. So next comes the classification of Dravya. According to Karya Karanavada, there are 2 classifications, Karya Dravya and as well as Karana Dravya. Okay. So Karana Dravyas, we are studied in Padartha Vijnana Navakarana Dravyas. So Kadinyatma, Mana, Kala, Dik are called as Navakarana Dravyas. Ka Adinyatma means Panchama Bhuta plus Atma, Manas, Kala and Dik. So overall 9 Karana Dravyas. Nava Karana Dravyas. Okay, next comes Karya Dravya. So what is available? The drugs and other things we can consider as Karya Dravya. This is the one classification of Dravya based on Karya Karana Siddhanta. So according to Chetana and Achetana, so in Charaka Samhita, Acharya has given a beautiful definition for Chetana and Achetana. Chetanam sa indriyam, nirendriyam achetana. Okay, so the drugs or the plants or anything in the universe, it has a Chetana, means it has an Indriya. Indriya, it will give you the meaning of it will respond to the stimuli. Got it? Anything in the universe, it has a Jiva, means it has a Chetana, means it will respond to the stimuli, either immediate or later. So you may ask, how plant will respond to the stimuli? If you cut down the plant, plant will die. That is the stimuli. If you cut down it, again it will grow. It is a stimuli. Later, it may react later, but it has a Jiva. It has a growth. Okay, so sa indriyam, chetanam, nirendriyam, achetanam. The technical word you need to remember is sa indriya and nirendriya. Acharya given these two technical words in a broad sense, so not in a congested meaning. Sendriyam, chetanam, nirendriyam, achetanam. The non-living things or dead things won't respond. They don't have indriya. So indriya means indriyartha and again manas and again atma. So indriyartha sanikarsha, you are reading padartha vijnana, how indriyartha sanikarsha will happen. So indriya, indriyartha, manas and atma. Okay, so we will respond. So indriyas means will respond. It is jiva. Okay, so that is sa indriyam, chetanam, nirendriyam, achetana. Charaka Sutra, first chapter. So most of the Padartha Vijnana definitions you will get in Charaka Sutra, first chapter, and also in Charaka Vimanasthana, and in Dravya Guna, Charaka 25th chapter, 26th chapter, Dravya Vargikarana classification will be there, Charaka Sutra. Okay, so just go through this Vargikarana, Atre Badrakapi Adhyaya, Charaka. So Rasa Sambhasha Parishad, all these things you will get in Charaka Sutra, 25th, 26th chapter. And also in Ashtanga Sangraha, Ashtanga Hridaya, will get it in Sudhrasthana only, Dravya Vargikarana. Sangraha 18, 19, 20, like that. So Hridaya, it will start early only, in the beginning chapters, 10 to 20 chapters only will get Dravya Vargikarana. Okay, so chapters belong to Dravya Guna. Okay. So Indriya, Nirendriya. So one more classification he has given, Chetana and Achetana. So again, Chetana is divided into two, Bahirantas Chetana and Antas Chetana. Bahirantas Chetana is Jangama Dravya, so the animals. Antas Chetana is Audbida Dravya. Okay. Acetanam is Nirendriya. According to Utpatti, so Utpatti Veda is based on Panchamahabhuta. Okay, so Parthiva, Tejasa, Jaliya, Vayuya, and Akashya. Sarva Bhutam Panchamahabhutatmikam. So Sarva Dravyam Panchamahabhutatmikam. So all dravyas are made up of Panchamahabhuta only. So nothing will escape from Panchamahabhuta. So according to Yoni, so Jangama and Audbida, so Jangama again divided into four, Jarayaja, Andaja, Svedaja, and Utvuja. You know about these classifications. Jarayaja means with placenta, Andaja means with egg. Okay, so Svedaja means that will come from the sweat. Udvija means it will directly take an origin from the earth. Okay, so this way the replication or reproduction of the animals taken place in the universe. So Jarayaja with the placenta, Andaja with egg. Example for Andaja is chicken, koli, duck, batukoli, snake. ಇದೆಲ್ಲ ಅಂಡಜದಿಂದನೇ ಬರೋದು. ಸ್ವೇದಜ ವಿತ್ ಅ ಸ್ವೆಟ್. ಸೊ ಸಮ್ ಕೀಟಗಳೆಲ್ಲ ಸ್ವೇದದಿಂದ ಉತ್ಪತ್ತಿ ಆಗತ್ತೆ. ಸೊ ಉದ್ಬೀಜ ಫ್ರಮ್ ದ ಅರ್ತ್. ಮಳೆಗಾಲದಲ್ಲೆಲ್ಲ ಬರ್ತಿರುತ್ತಲ್ಲ. Next, Audbida classification you should remember Vanaspati and Vanaspatya. From the day one of Ayurveda, you have a confusion with Vanaspati and Vanaspatya. So still after completion of Ayurveda also you will have a confusion. What is Vanaspati and what is Vanaspatya? Vanaspati is Pushpa Adrushya. So just think about one more common name for Vanaspati in our routine term is Dalda. So Vanaspati is Dalda. But here Vanaspati means Pushpa Adrushya. So we cannot see the Pushpa directly, we can see the fruit. Example, Vata, Udumbara. So with the plants, we cannot see the flowers. Directly we can see the fruits. ಅದಕ್ಕೇನೋ ಫ್ಲೋರಸೆನ್ಸ್ ಅಂತ ಕರೀತಾರಲ್ಲಪ್ಪ. You studied in second PU. What type of fluorescence it is? Incarnate fluorescence antana correct. The fruit incorporate both the flower and the fruit features. Okay, so that is Vanaspati. Vanaspati means there is no Pushpa. Pushpa Adrusha, and directly we will get the flowers. Vanaspati. Vanaspatya, Pushpa and Phala both we can see. So majority of the fruits are from the flowers. Okay, that is Vanaspatya. Viruda. So Viruda means the creepers. So, yeah, the climbers, we can call it as climbers or creepers. Lata, Gulma, Itaradella called as Viruda. So Aushada, small shrubs, that is Aushada. Audbita Dravya, we have 4 classifications. Vanaspati, so fruit without flower. Vanaspatya, fruit with flower. And then Viruda is creepers or climbers. So Aushada is arbors. Here you need to remember is Vanaspati and Vanaspatya, the difference. So easy question antandra nimge idin keltare ashte. That easy question in AAPGT means very direct question. Difference between Vanaspati and Vanaspatya. ಇದಕ್ಕಿಂತ ಈಸಿ ಕ್ವಶನ್ ಏನು ಕೇಳಲ್ಲ. ಡೈರೆಕ್ಟ್ ಆಗಿ ದ್ರವ್ಯ ಅಂದ್ರೆ ಏನೋ, ಗುಣ ಅಂದ್ರೆ ಏನೋ, ದ್ರವ್ಯ ಕ್ಲಾಸಿಫಿಕೇಶನ್ ಇದೆಲ್ಲ ಏನು ಕೇಳಲ್ಲ. ಸೊ ದಾಟ್ ಮೀನ್ಸ್ ದ ಡಿಫರೆನ್ಸ್ ಬಿಟ್ವೀನ್ ವನಸ್ಪತಿ ಅಂಡ್ ವನಸ್ಪತ್ಯ. ಓಕೆ. And Bauma Dravya having a Prakrita and Krutrima. So Prakrita means natural origin. Krutrima means artificial. So again, the drugs are classified into two, Prakrita and as well as Krutrima. According to Prayoga Veda, so Aushadha Dravyas, Prayoga Veda, we have Virya Pradhana. So this is the classification according to Chakrapani. You just note it down. The classification according to Chakrapani. The Dravyas are classified 3 types based on Prayoga Veda. So Prayoga Veda, there are 2 types, Aushadha Dravya and as well as Ahara Dravya. Prayoga Veda Dravya having 2 types. One is Aushadha Dravya, one more is Ahara Dravya. In Aushadha Dravya, we have a reference of Chakrapani, Tika, in Charaka Samhita. This is very important. They will ask you with an examples. Aushadha Dravya classification. So in general dose of churna, it is 1 tola, that is around 12 grams. General dose. It may be Sitaphala churna, it may be Talisadi, Lavana Bhaskara, whatever may be the churnas. The classification of churnas is the dose of churnas in a day is 12 grams. But we cannot take 12 grams of Trikatu, we cannot take 12 grams of Shunti. So for that, again, Acharya Chakrapani has given some classification of this Dravya Prayoga. Okay, so it just note down. So Acharya has given Tikshna Virya Dravyas. Tikshna Virya Dravyas are 1 Karsha. Tikshna Virya Dravyas, the dose of Tikshna Virya Dravyas per day is only 1 Karsha. Example is Shunti. Example is Shunti. Madhya Virya is half Pala. Example is Bilva. What is the dose of Bilva? Ardha Phala. Bilva Phala is Ardha Phala. Mrudu Virya, 1 Phala. For example of Mrudu Virya is Amalaki. Example of Mrudu Virya is Amalaki. Okay. So Tikshna Virya Dravya dose is 1 Karsha. Example is Shunti. Madhyama Virya classification is half Phala. One example they are given is Bilva. And then Mrudu Virya Dravya is 1 Phala. Example is Amalaki. Okay, so this is the classification of Aushadha Dravya according to Chakrapani. You must remember this is the classification according to Chakrapani. Directly they will ask the question Tikshna Virya Dravya, dose of Tikshna Virya Dravya according to Chakrapani. So dose of Madhyama Virya Dravya according to Chakrapani, dose of Mrudu Virya Dravya according to Chakrapani. The question may ask directly with these headings. So just make a star mark over this, or else make your any marks, any strong marks over there. This is the important FAQ. So many a times they asked in APG. Till today, more than 20 times they asked in APGT since the entrance exam start all over India since 2000. 22 ವರ್ಷದಲ್ಲಿ from last 22 years, at least 20 times they asked about this question. Very important FAQ. And one more thing, almost all ahara dravyas are rasa pradhana, aushadha dravyas are virya pradhana. So what is the difference between ahara dravya and as well as aushadha dravya? Both are dravyas only. Both the things we will use in mitigating the disease, in curing of the disease. So on what basis we need to calculate the action of a dravya? Some drugs will work on rasa, some drugs will work on virya, some drugs will work on vipaka, some drugs will have an action with the prabhava. Okay, so that's why the rasa panchaka is explained in dravya guna. So how we will calculate the efficacy of our ahara dravya? So ahara dravya's efficacy can be calculated based on the rasa. Okay, ahara dravyas are rasa pradhana. Aushadha dravyas are virya pradhana. When you're giving the medicine to the patient, you should calculate the virya. You can calculate the efficacy of a drug based on virya. When it is an aushadha, when it comes to the aushadha, you should think about their virya. You should think about their prabhava. Ahara dravya is limited to rasa and vipaka. Aushadha dravya is limited to virya and prabhava. So based on rasa, then we can calculate virya and again vipaka and prabhava. So always one thing you should keep it in your mind. While prescribing an ahara, you should think about rasa. While prescribing an aushadha, you should think about virya. Then one more followed question in this pattern. What is the amount of ahara dravya can be advised in a single dose in a single day? How much ahara? 4 phalas. 4 phala ahara can be advised in a single dose. Around 200 grams. Okay. So for example, when come to the Charaka Samhita Prameha Adhyaya, Charaka Chikitsa, extra chapter of Prameha? Prameha Adhyaya number, Prameha chapter number in Charaka Chikitsa. 6th or 7th? Sure. Eli Charaka Chikitsa chapters. Rasayana, Vajikarana, Jwara, Rakta Pitta. Gulmana third? Ala, 4th. 5th. 5th is Gulma. 6th. Prameha. 7th. Pushta. 8th. ಈಗ ಪ್ರಮೇಹ 6th ಆಯ್ತಾ 7th ಆಯ್ತಾ 6th ಪ್ರಮೇಹ. Okay. Aligners. The serial number of chapter Prameha in Charaka Chikitsa. The serial number of chapter Prameha in Charaka Nidana. Charaka Nidanadalli ಪುಷ್ಟ ಆದ್ಮೇಲೆ ಉನ್ಮಾದ ಅಪಸ್ಮಾರ. ರಾಜಾಕ್ಷಮ ಬಿಟ್ರಲ್ಲಪ್ಪ, ರಾಜಾಕ್ಷಮಲ್ಲಿ ಬರುತ್ತೆ, ಮರ್ತ್ಬಿಟ್ಟಿದ್ರೆ ರಾಜಾಕ್ಷಮ. ಸೊ ರಾಜಾಕ್ಷಮ ಐತಾ ಇವೆಲ್ಲ ಪ್ರಿಪರೇಷನ್ 2025 ಮಾಡಂಗಿದ್ದೀರಾ. 2023 ಮುಗೀತು, 2024 ಮುಗೀತು, 2025. ಸೊ ಆರಾಮಲ್ಲಿ ನಿಧಾನಕ್ಕೆ ಪ್ರಿಪರೇಷನ್ ಮಾಡೋಣ ಅಂತ. ಪ್ರಮೇಹ ಚರಕ ಚಿಕಿತ್ಸಾ ಪ್ರಮೇಹ ಇಸ್ 6th, 7th ಕುಷ್ಟ, 8th ರಾಜಾಕ್ಷಮ, 9th ಅಪಸ್ಮಾರ ಫಸ್ಟ್, ಉನ್ಮಾದ ಫಸ್ಟ್. ಉನ್ಮಾದ ಫಸ್ಟ್ ಆಮೇಲೆ ಅಪಸ್ಮಾರನ ಚೆಕ್ ಮಾಡಿ. ಅಪಸ್ಮಾರ ಆದ್ಮೇಲೆ ಉನ್ಮಾದನ, ಉನ್ಮಾದ ಆದ್ಮೇಲೆ ಅಪಸ್ಮಾರನ. 10th ಅಪಸ್ಮಾರ. ಓಕೆ, ಪರವಾಗಿಲ್ಲ. 2023ಗೆ ಎಕ್ಸಾಮ್ ಬರೆಯಂಗಿದ್ದೀರಾ. ಓಕೆ. So in Charaka Prameha Dhyaya, while giving the Patya, when we come to the Patya, it is definitely Ahara, Vikara, and Aushadha. So all these three you can consider the Patya. So here Ahara and Vikara, in Ahara particularly Acharya explaining about Ahara in Prameha. So in many folds, Acharya Charaka has given importance for Yava, and Yava based different preparations. One thing. Second one is Acharya has given importance for Sattu. Sattu is yellow colored pea, yellow colored batani, peas. So now commonly what we have seen the pea is green color pea. The yellow, particularly the yellow color piece Acharya has mentioned, it is called as Sattu. And we have studied why only the Sattu Acharya has advised. Why can't he explain about green peas? It contains 17% of protein. The green peas contains 16%, less than 15% of protein. But yellow peas contains highest amount of protein in their group. And third one is Mudga. Yava, Sattu, Mudga. And Atasi Sarshapa Taila. Even Taila also Acharya mentioned very clearly Atasi Taila, Aksya Bija, flaxseed oil, and Sarshapa Taila, mustard oil. Very clearly Acharya has explained about the Ahara Dravya and Patya in Prameya. And Tikta Shakai. Tikta Shaka. Shaka means so vegetables. In the vegetables, Acharya has given very clear indication about Tikta Shaka. Tikta Shaka means green leaf vegetables. So almost all green leaf vegetables are not Madura, are Tikta Shakai. So very clear cut Patya is explained in the chapter of Prameha about Ahara. Yadu, Yava, Sattu, Mudga, Ataksi Sarshapataila, and as well as Tikta Shaka. So when patient come to your clinic, if they ask about Prameha diet, you should prescribe only this. Maybe type 1 diabetes, type 2 diabetes, they want to control diabetes, they want to reverse diabetes, keep the patient only on this diet pattern. So Goduma also mentioned, but not in a huge quantity. But Goduma is Kafakara, Russia. So in Prameha, the Nidana of Prameha, Acharya explained about Kafakuchra Sarva. Whatever the Ahara and Vihara that will going to increase Kafa is the eighth for Prameha. Kafakuchra Sarva. So in that case, we should not advise Goduma as a staple food in case of Prameha. Again, it will aggravate Kapha, and again it will aggravate Prameha. Okay, so in treating a disease in present day clinical Ayurveda practice, diet is most important. Many a times people come to the Ayurveda clinic to know about their diet pattern. Okay, so if you are a clinician, so we should concentrate much on diet of the patient rather than prescribing some medicines. So efficacy of medicine compared to the diet is less. So many diseases, many autoimmune diseases is because of irregular lifestyle and food style. So we should concentrate on their lifestyle and food style. Then only we can reverse the disease. Okay, this is very important thing we need to note down when the diet comes to prescription. Okay, so Ahara Dravya, Rasa Pradana, the dose will be 4 Phala. Then we have checked in the patient about we are advising only Mudga. So only Mudga. Whole week we are advised only Mudga. So morning Pongal, afternoon Mudga Sambar, evening night Mudga preparation, only Mudga, raw Mudga he can eat. So 1 week we kept patient in Mudga diet, then we have checked the FBS, PPBS, it is under control. Patient having a GRBS 350 after advising Mudga diet for a week along with Pitta, Shaka and Yava. So patient glycemic index, the glucose level fasting and postprandial is under 200. Okay, the food plays a major role in reversing a disease. ಸುಮ್ನೆ ಹೇಳಿಲ್ಲಪ್ಪ 2 ವರ್ಷ 2000 ವರ್ಷದ ಹಿಂದೆ the words we don't know, glycemic load, glycemic index, calories, So during that period only, Acharya has simply given we should follow these things. That's all. Okay, just follow. And the non-veg food also Acharya advised the Vihangama pranis. The pranis moves in larger extent. So example, sheep and goat, they will walk and eat these animals. So yeah, he didn't advise about chicken. ಅದು ಒಂದು ಕಡೆನೇ ಇರುತ್ತೆ. So and then fish, it will move in the water in larger extent. So these non-veg foods doesn't contain much amount of fat. Very clear cut indication. The non-vegetarian foods also doesn't contain much of fat. Those food items only you should consume. Prameha. Okay, our type 1 diabetes, type 2 diabetes, gestational diabetes. So PAD, LAD, all these types of diabetes will comes under Prameha spectrum. Prameha group of diseases. Okay, here diet is most important along with exercise. So Acharya told, Acharya Sushruta has given clear-cut definition for exercise. So one should walk. So Sahasra Yojana is given. So 1,203 kilometers walk has to done in a year. 1,203 kilometers we need to walk in a year. So calculate per day how much kilometers we need to walk. At least 3.5 to 4 kilometers. Okay. So how to get rid of Prameha? Acharya has given clear indications. So you should live like a yogi, or else the one will move from place to place. So always you should walk, and the food, whatever if the food we will get, we have to eat. No specifications. Take the shaka and other things, whatever the foods available, we have to eat, and we have to move. So that is the level of exercise we need to do in Prameha. So if you do particular exercises, the blood flow towards the muscles becomes increases, and oxygen carrying capacity of the hemoglobin is increases, and insulin resistance decreases. So muscle strength will come, muscle nourishment will come, muscle growth will be very proper. Not only single muscles, all muscles. Then insulin resistance will reduce, diabetes will control automatically. Okay, so it's a very clear-cut indications about ahara and vihara. When any diseases, if you given a particular ahara and vihara very correctly, things will be all right. Medicine is a third one. As we are an Ayurveda practitioners, medicine is a third importance we should give. First is ahara, second is vihara, third is aushadha. And you just check in any chapter of Charaka Samhita of Nidana Sthana and Chikitsa Sthana. So Acharya has given much importance for Aharaja Nidana and Viharaja Nidana. So Vata classification is the Vata Jahara Vihara Kodare, that is the Yetu for this Vata Jagulma, Pitta Jahara Vihara and particular Yetu for Nidana for Pitta Jagulma. You just check it out. Any chapter of Charaka Samhita, their Yetus are based on dosha and Ahara Vihara. Okay, they are given most importance for ahara and vihara. Okay, so based on the classification, prayoga bedena ahara is one classification and aushadha is one classification. In aushadha, again we have tikshna, madhyama, and mrudu. According to dosha karma, the shamana, kopana, and swasthaita. So next classification of dravya is according to dosha karma, shamana and kopana. Third is swasthaita. So some medicines will use for shamanartha, some medicines will use for kopanartha. So kopana means snehapana, what will use? It will use to aggravate the doshas, lina dosha to aggravate. Shamanam, kopanam, swastarutta itam. Swastha is again divided into two parts, urjaskara and roganut. Swastasya urjaskara and atarasya roganut. So urjaskara is rasayana and vajikarana. So what are the urjaskara aushadhas? Rasayana and vajikarana will come in urjaskara aushadhis and roganut. So apunarbhava dravyas. So again it will come shodhana and then rasayana, apunarbhava dravyas, or adravya. So other than drugs, we'll use money mantra dharana. So all these things will come in Rogarat. Next comes according to rasa, the drug classification again it becomes a 6 classification based on rasa, maduraskanda, amlaskanda, lavanaskanda, katuskanda, tikta, and kashaya skanda. So every skanda drugs, Acharya has given example for every skanda and option of each skanda drugs. Okay, Charaka Sutra first chapter only will get the detail, and in Ashtanga Sangra, Ashtanga, everywhere we will get skanda details. Okay. According to Virya, so dravyas are classified into two: Chita Virya dravyas and Ushna Virya dravyas. According to Vipaka, so Madura, Amla, Kata Vipaka. There is no Lavana Vipaka and Kashaya Vipaka. So Madura and Lavana at times, Madura Vipaka. So Amla Rasa will at times, Amla Vipaka. Katita Kashaya at times, Kata Vipaka. It's a natural rule. Natural. So according to Shodhana and Shamana, Samshodhana Varga and as well as Samshamana Varga. According to Dravya Prayoga, Beshaja and Abeshaja. So many medicines are available. Some we can use it as a medicine, some you will not use it as a medicine. So Beshaja and Abeshaja. So in number, questions as in numbers, in Dravya Guna, they will ask as a Dravya Vargikarana. Ahara Dravya and Aushadha Dravya Vargikarana. In detail about Ahara Dravya and Aushadha Dravya Vargikarana, they will ask. So Charaka Sutra 27 chapter. So here Acharya has given 12 vargas. Shukadanya, Shumbidanya, Mamsa Varga, Shaka Varga, Phala Varga, Harita Varga, Madhya Varga, Jala Varga, Gorasa Varga, Ikshu Varga, Pritrimanna Varga, Ahara Yoni Varga. So like that. So Acharya has made 12 classifications of Ahara and Jala Vargikarana. Again in Sutrasthana 45th, 46th chapter, Acharya has given 23 vargas. So like that. In Ashtanga Sangraha 12 varga, Ashtanga Hridaya 12 varga. So Ashtanga Sangraha, Dravadravya are 6, Annadravya are 6. Ashtanga Sangraha, Ahara Dravya Vargikarana totally 12. So out of 12, Dravadravya he made 6, Annadravya 6. Dravadravya 6 and Annadravya 6. In Ashtanga Hridaya, Dravadravya 5, Annadravya 7. Dravadravya 5, Annadravya 7. Dravadravya 5 and Annadravya 7. So Dravadravya Jala Varga, Ikshi Varga, Madhya Varga, Kshira Varga, Taila Varga. So this is Dravadravya. So in Annadravya, Shukadanya, Krutanna, Shaka Varga, Aushadha Varga, Shimbidanya, Vamsa Varga, Phala Varga. So like that. Just to Phala, according to Charaka. Phala. Amalakida. Amalaki Draksha. Drakshana. Check my daily. Best Phala according to Charaka. Amalakina Drakshana. Brudvika. Yes, correct. ಆನ್ಲೈನಲ್ಲಿ ಆನ್ಸರ್ ಕೊಟ್ಟರು ಮೃದ್ವಿಕ. ಪರವಾಗಿಲ್ಲ, ಜನ ಬೆಳಿಗ್ಗೆ ಬೇಗ ಮಲ್ಕೊಂಡಿರ್ತಾರೆ ಅನ್ಕೊಂಡೆ. ದೇರ್ ಅಲರ್ಟ್ ಇನ್ ಆರ್ಲಿ. ಕರೆಕ್ಟ್ ಪೂಜಾ. ಮೃದ್ವಿಕ ಇಸ್ ಶ್ರೇಷ್ಠ ಫಲ ಅಕಾರ್ಡಿಂಗ್ ಟು ಆಚಾರ್ಯ ಚರಕ. So some of the other points related to dravya, Charaka has included dugdha, dadi, etc. in Gorasa Varga, whereas Ushta mentions it in Kshira Varga. Dadi, Gruta, Takra has 4 different vargas. This has ಸ್ವಲ್ಪ other points ಎಲ್ಲ ಇದೆ. Just go through it. We'll send the material. So after this will comes Mishtaka Gana. Other Acharya's classifications, Dhanvantra Nigantu, there are 7 Vargas. Just write down Dhanvantra Nigantu, 7 Vargas. Dhanvantra Nigantu, 7 Vargas. Madanaphala Nigantu, 13 Vargas. Dhanvantra Nigantu, 7. Madanaphala Nigantu, 13. Rajanigantu. Rajanigantu. What is the one more name for Rajanigantu? Can anybody tell other name for Rajanigantu? ಇಲ್ಲಿ ಕೊಟ್ಟಿಲ್ಲ ಮೆಟೀರಿಯಲ್ ಎಲ್ಲ ನೋಡಕ್ ಹೋಗ್ಬಿಡಿ. ವಾಟ್ ಇಸ್ ಅದರ್ ನೇಮ್ ಫಾರ್ Rajanigantu? So you heard about Abhidhana Chudamani. Abhidhana Chudamani is the one more name for Rajanigantu. So who is the author of Rajanigantu? ಅವೆಲ್ಲ ಕೇಳ್ಬೇಡಿ ಸರ್, ಇತಿಹಾಸ ಮುಗಿದು ವರ್ಷಗಳಾಗಿದೆ ಅಲ್ವಾ? So you'll remember only during examination.
Narahari, sir.
Bhatta Narahari. Yes. Bhatta Narahari is the author of Rajanigantu. Next, Kayadeva Nigantu. So total Vargas are 9 in number. Total Vargas are 9 in number. So author is Kayadeva. So here the question is, what is the other name of Kayadeva Nigantu? Very famous name. Patya Patya Nibodhini. Patya Patya Vibodhini or Nibodhini. Patya Patya Vibodhini. Correct. Correct. Kayadeva Nigantu is also known as Patya Patya Vibodhini. There are 9 Vargas according to Kayadeva Nigantu. So material detail ಆಗಿದೆ ಯಾವ ವರ್ಗ ಅಂತ. ಸೊ ಅದ್ರಲ್ಲಿ ಡಿಫರೆನ್ಸ್ ಒಪಿನಿಯನ್ ಇರೋದನ್ನ ಜಸ್ಟ್ ಮಾರ್ಕ್ ಮಾಡ್ಕೊಳ್ಳಿ. ನೆಕ್ಸ್ಟ್ ಭಾವಪ್ರಕಾಶ ನಿಘಂಟು 22 ವರ್ಗಾಸ್ ಪ್ಲಸ್ ಅಭಾವ ವರ್ಗ added extra 22 plus 1 23. ಇದೊಂದ್ಸಲ ಚೆಕ್ ಮಾಡಿ. 22 plus 1 ಇದೆ, ಇದು 23 ಇದೆ. ಜಸ್ಟ್ ಚೆಕಿಂಗ್. ಚೆಕ್ ಭಾವಪ್ರಕಾಶ ನಿಘಂಟು 22 ವರ್ಗಾಸ್ ಪ್ಲಸ್ 1. ಭಾವಪ್ರಕಾಶ ನಿಘಂಟು ಜಸ್ಟ್ ಚೆಕ್ ಇಟ್ ಔಟ್. ಸೊ 22 plus 1 ಇದೆ, ಅದು ಸ್ವಲ್ಪ ಮಿಸ್ಟೇಕ್ ಆಗಿದೆ ಅನ್ಸುತ್ತೆ. ಜಸ್ಟ್ ಚೆಕ್ ಮಾಡಿ ಒಂದ್ಸಲಿ. So out of that, the best Vargikarana in the modern age in the Nigantu is Bhavaprakasha Nigantu. Okay. This is about Dravya Vargikarana. So general classification. Next comes Mishtaka Gana. So this Mishtaka Gana is most important. So in Dravya Gana, Dravya Vargikarana and all them ask you one question, but in Mishtaka Gana definitely you will get one question. Expected, most expected. In part 1, the most expected question will come from Mishtaka Gana. Okay. So I will give you some list of important Mishtaka Ganas and you need to memorize. So overall one 25 3 drugs ಬರುತ್ತೆ. 3 or 4 drugs to 5 drugs to 1 to 20 ಎಲ್ಲ ಸೇರಿ ಒಂದು 50-60 ಮಿಶ್ರಗಣ ಆಗುತ್ತೆ. ಸೊ hardly 2 to 3 pages if write ಮಿಶ್ರಗಣ and memorize daily. Okay, so difference ಇರೋದನ್ನ ಮಾರ್ಕ್ ಮಾಡ್ಕೊಂಡ್ರೆ you can memorize it daily. We'll start with trifala. So parya is falatrika, shrestha, vara, all are synonyms of trifala. Amalakirithaki and vibhita. You can just ask yourself why only Acharya joined Amalakirithaki and vibhitaki. You just check it out. Except all three are having a pancharasas. Okay, Amalaki, Shita Virya, and Haritaki is Ushna Virya. And just check the Rasaguna Virya Paka of Haritaki and Vibhitaki. Both are having almost similar Rasaguna Virya Paka, Haritaki and Vibhitaki. But here, one part of Haritaki, 2 part of Vibhitaki, and 4 part of Amalaki. So general combination. Amalaki is highest. 1:2, 2:4. In some classifications, 1:1:1 only they're doing, but 1 part Haritaki, 2 part Vibhitaki, and 4 parts Amalaki. In the complete analysis, here Vibhitaki is a stabilizing factor between an Amalaki and as well as Haritaki. So Vibhitaki is not so Shita and not so Ushna, so intermediate. Okay, so there are 2 friends, both are not talking each other, and one intermittent friend. I will stabilize these 2 friends. So just like stabilization action will be expected from Vibhitaki here. Okay, so like Trifala action is extraordinary because of its combination. Okay, like that only in everywhere Acharya made the combinations like that only. Start from Charaka Samhita from 2000 2500 years. So their combinations is based on their drug stability and drug action and release of alkaloids in a particular formulations. So everything they will look in and then only they will make the combinations. Sumne mix madala. Okay, so biryani tara adondaku, idondaku. No. So they have some reasons behind the formulations. The drug stability must be achieved once it is combined. Okay, so Sulfa Trifala is Kashmariya Karjura Parushaka, KKP. So ನಿಮಗೆ ತ್ರಿಫಲ ಅಂದ್ರೆ ಗೊತ್ತಾಗ್ಬಿಡುತ್ತೆ. ನೆಕ್ಸ್ಟ್ ಸ್ವಲ್ಪ ತ್ರಿಫಲ ಅಂದ್ರೆ ಯೋಚನೆ ಮಾಡಿದಿರ. Here it is Kashmariya Karjura and Parushaka. Kashmariya Karjura and Parushaka is Swalpa Trifala, KKP. Swalpa Trifala is Kashmariya Karjura and Parushaka. Swalpa Trifala, KKP. Madura Trifala, Amalaki Madura ಇರಲ್ಲ. Have taken Trifala Churuna or Trifala Kashaya? It is palatable. Those who likes Madura, it is not palatable. Those who likes Kashaya, it is good. Those who likes Tikta, it is good. Okay. So Madura Trifala is Kashmariya, Karjura and Draksha. So Madura Trifala is first explained in Rajanigantu. It is also KKP, Kashmariya, Karjura and Draksha. Madura Trifala is Kashmariya, Karjura and Draksha. First explained in Rajanigantu, it is KKP. Next, Sugandha Trifala. ಇದು 3 ಫಲಗಳೇ ಇದೆ, ಬಟ್ ಇಟ್ ಈಸ್ ಸುಗಂಧ. ಜಾತಿ ಫಲ, ಪೂಗಫಲ, ಲವಂಗ. ಜಾತಿ ಫಲ, ಪೂಗಫಲ, ಲವಂಗ. ನೋಟ್ ಡೌನ್. ಜಾತಿ ಫಲ, ಪೂಗಫಲ, ಲವಂಗ. ಜಾತಿ ಫಲ, ಪೂಗಫಲ, ಲವಂಗ. ರೆಫರೆನ್ಸ್ ರಾಜನಿಘಂಟು. ಸುಗಂಧ ತ್ರಿಫಲ. Okay, this about Trifalas. Trifala, Swalpa Trifala, Madura Trifala, Sugandha Trifala. All Trifalas. Next, Trikatu. You will remember Shunti Maricha and Pipali. Okay. So next, Trimada. Vidanga Musta Chitraka. Vidanga Musta and Chitraka. Trimada is Vidanga Musta and Chitraka. Trijata. त्रिजाता त्वक एलाट पत्र. त्वक एलाट पत्र is त्रिजात. त्रिकंटक बृहति कंटकारी दुस्पर्श. दुस्पर्श is ಧನ್ವಯಾಸ. ಕಂಟಕಾರಿಗೆ ಇನ್ನೊಂದು ನೇಮ್ ಇದೆ ಅಗ್ನಿ ದಮನಿ. ಕಂಟಕಾರಿಗೆ ಒನ್ ಮೋರ್ ನೇಮ್ ಇಸ್ ಅಗ್ನಿ ದಮನಿ. Trisama Gutika was a very good example of Kashyap's brevity. So Trisama or Trisama Gutika is the famous formulations of Kashyapa Samhita. So it contains Haritaki, Shunti and Guda. Haritaki, Shunti and Guda. Trisama Gutika. Haritaki, Shunti and Guda. Trisama Gutika. Haritaki, Shunti and Guda. Trisama is Haritaki, Shunti and Guda. Trikarshika. Mufta Ativisha Shunti. Trikarshika. SAM. Sam. You should remember Sam. Trikarshika. Mufta Ativisha and Shunti. Mufta Ativisha Shunti. ಅಥವಾ ಮಾಸ್ ಆಗುತ್ತೆ. MAS. Musta Ativisha Shunti. Mass. Mass is Trikarshika. Chaturjata, you will remember easily. Twak, Ela, Patra and Nagakesara. Twak, Ela, Patra and Nagakesara. Nagakesara is such a drug we will use in Raktastambha, metrorrhagia conditions, or bleeding time. You can use Nagakesara with butter as a Raktastambha. Chaturushana. Shunti, Maricha, Pipali, Pipali Mula. Chaturushana. Chaturushna or Chaturushana, should remember. Shunti, Marichi, Pipali and Pipali Mula. Shunti, Marichi, Pipali and Pipali Mula. Chaturushana. Shunti, Marichi, Pipali and Pipali Mula. Chaturbhadra. Musta Ativisha Shunti Guduchi. Chaturbhadra. Chaturbhadra. Musta Ativisha Shunti Guduchi. Musta Ativisha Shunti and Guduchi. Chaturbhadra. So very common question in APGT from Kaumarevadya. So in UG studies, one drug you remember for any pediatric illnesses is Bala Chaturbhadra. What are the ingredients of Bala Chaturbhadra? Bala Chaturbhadra Rasa, Bala Chaturbhadra Vati. So now Bala Chaturbhadra syrup is also available in the market. Yadaditu, Musta you will remember, Ativisha you will remember, Pipali you will remember. One more, Karkatashrangi. Musta, Ativisha, Pipali, Karkatashrangi. Musta, Ativisha, Pipali, Karkatashrangi. Musta, Ativisha, Pipali, Karkatashrangi. Musta, Ativisha, Pipali and Karkatashrangi. Katu Chaturjata. Twak Patra Ela Maricha. Twak Patra Ela and Maricha. Twak Patra Ela and Maricha. Katu Chaturjata. Katu Chaturjata. Twak Ela Patra and Maricha. Katu Chaturjata. So ಭಾವಪ್ರಕಾಶದ ಇನ್ನೊಂದು ಚತುರ್ಬೀಜ ಅಂತ ಕೇಳ್ತಾರೆ. ಭಾವಪ್ರಕಾಶದ ಫ್ರೆಂಡ್ಸ್ ಚತುರ್ಬೀಜ, ದಿಸ್ ಅಕಾರ್ಡಿಂಗ್ ಟು ಭಾವಪ್ರಕಾಶ. ಮೇತಿಕಿ, ಚಂದ್ರಶೂರ, ಕಾಲಾಜೀರ, ಯವಾನಿ. ಮೇತಿಕಿ, ಚಂದ್ರಶೂರ, ಕಾಲಾಜೀರ, ಯವಾನಿ. ಮೇತಿಕಿ, ಚಂದ್ರಶೂರ, ಕಾಲಾಜೀರ, ಯವಾನಿ. ಪಂಚಕೋಲ, ವೆರಿ ಕಾಮನ್. Pipali, Pipali Mula, Chevachitaka, Nagara. Panchakola. Pipali, Pipali Mula, Chevachitrakand, Nagara. Sequencing Madan Emperor. So Pipali, Pipali Mula, Chevachitrakand, ನಾಗರ. ಪಂಚಫಲ. ಪಂಚ ಸುಗಂಧ ಕೂಡ ಒಂದಿದೆ. ಕಂಕುಲ, ಕರ್ಪೂರ, ಪೂಗಫಲ, ಜಾತಿ ಫಲ, ಲವಂಗ. ಪಂಚ ಸುಗಂಧ. And in case of skin disorder, in case of psoriasis, you will remember Panchanimba. Panchanimba is nothing but 5 parts of Nimba. So Nimba Patra, Moola, Phala, Tvak, and as well as Pushpa. All 5 parts of Nimba. So we can call it as Pancha Nimba. ಇದು 3 and 5 ಇರ್ತಕ್ಕಂಥದ್ದು. ನೆಕ್ಸ್ಟ್ ಪಂಚಗವ್ಯ, ಪಂಚಾಮ್ಲ, ಆಮ್ಲ ಪಂಚಕ, ಪಂಚತಿಕ್ತ, ಲವಣ ಪಂಚಕ, ಪಂಚಪಂಚಕ. Okay. ಬೃಹತ್ ಪಂಚಮೂಲ, ಲಘು ಪಂಚಮೂಲ. ಬೃಹತ್ ಪಂಚಮೂಲ, you should remember Bilva, Shonaka, Agrimanta, Patola, Kashmirya. Kashmirya is also known as Gambari. Bೃಹತ್ ಪಂಚಮೂಲ. So Bilva, Shonaka, Agrimanta, Patola, and Kashmirya. Bೃಹತ್ ಪಂಚಮೂಲ. So Laghu Panchamula is Shalaparne, Prishtaparani, Bruhati, Kantakari, and Gokshura. So Shalaparni, Prishtaparni, Bruhati, Kantakari, and Gokshura. So Bruhat Panchamula and Laghu Panchamula combined, it's called as Dashamula. So Dashamula drugs you should remember. Bruhat Panchamula and Laghu Panchamula becomes Dashamula. And Kantaka Panchamula. Kantaka Panchamula is Gokshura, Karamarda, Sairayaka, Shatavari, and Imsra. All are having Kantaka. Kantaka is Thor, so Mullirate, all plants. So that's why it's called as Kantaka Panchamula. Valli Panchamula, the climbers. So Vidari, Sariva, Manjishta, Gudochi, Meshastongi. Valli Panchamula. Truna Panchamula. Usually we'll remember about Truna Panchamula group of tracks. Kusha, Kasa, Nala, Darba, Ikshu. Kusha, Kasa, Nala, Darba, and Ikshu. Sushrutokta Pancha Panchamula. Acharya Sushruta has given Pancha Panchamula, Bruhat Panchamula, Laghu Panchamula, Kantaka Panchamula, Valli Panchamula, and Truna Panchamula. These 5 Panchamulas Acharya Sushruta has called as Pancha Panchamula. Yadadu Bruhat Panchamula, Laghu Panchamula, Kantaka Panchamula, Valli Panchamula, and Truna Panchamula. Valli and Kantaka one ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ, ಮಿಕ್ಕಿದ 3 ನೆನ್ಪಿರುತ್ತೆ. Regarding Pancha Panchamula of Sushruta. Again, Acharya Ashtanga Hridaya, Madhyama Panchamula anta one classification ಮಾಡಿದ್ದಾರೆ. Madhyama Panchamula is Punarnava, Bala, Eranda, Mudgaparani, Mashaparani. Punarnava, Bala, Eranda, Mudgaparana, and Mashaparani. Jivaniya Panchamula. Jivanti, Jivaka, Rushavaka, Vari, Abiru. Ashtavarga is important, Bhava Prakasha, and most important question is Ashtavarga Pratinidhi Dravyas. Jivaka, Rushabaka, Pratinidhi Dravya, Meda, Mahameda, Pratinidhi Dravya, Kakoli, Shirakakoli, Pratinidhi Dravya, Ruddhi, Ruddhi, Pratinidhi Dravya. So this is a very common question asked in AAPGT. So Ashtavargas are Jivaka, Rushabaka, Meda, Mahameda, Kakoli, Shirakakoli, and Ruddhi. So Ashtavargas are nothing but patient come to the clinics and they're asking about some multivitamin medicines, multimineral medicines. At that time, we will think about what we can give as a multivitamin and multimineral. And in Vata Javadis, we need some Madura rejuvenators, drugs. Arakashaya, directly we can give. So we will think about all those things, and very suitable drug you can add as a multivitamin, multimineral, and Dhatu Ruddhikaraka, and Rasayana, Rushya. Action we can expect Shrestha Vatahara. We can use it in peripheral neuropathy, peripheral nephropathy conditions. So the drug is Ashtavarga. Okay, the single drug Ashtavarga drugs, 8 drugs we can use in this as a rejuvenative, as a rasayana aushadhi. And a simple we can advise as a rasayana and vajikarana. So I use it in many cases of sciatica, nerve damage, nerve and sheath damage, okay, peripheral neuropathy conditions, burning foot, okay. So any nerve rejuvenation, so cellular rejuvenation, tissue rejuvenation. So in order to improve their regular girth of the body, weight of the body, we can use Ashtavarga Dravya. So in the market, Ashtavarga Kashaya is available. Ashtavarga Kashaya Ganavati is available. So we can utilize this drug. Okay. ಏನಾಗುತ್ತೆ ಪೇಷಂಟ್ ಬರ್ತಾರೆ ಅವಾಗ ನಂಗೆ ಡ್ರಗ್ ನೆನಪಾಗಲ್ಲ. ಇದೇನಾಗತ್ತೆ ಅಂದ್ರೆ ಇಫ್ ಯು ಪ್ರಾಕ್ಟೀಸ್ ಯು ವಿಲ್ ರಿಮೆಂಬರ್. If you do some other work means you won't remember. If you work in allopathy hospital for 3 months, you will forget about Triphala. Again, you will ask, what Triphala contains? So, ಅದರಲ್ಲಿ ಅರಿತಕ್ಕಿತ್ತ ಆಮ್ಲಕ್ಕಿತ್ತ ಇಲ್ಲಿ ಶುಂಠಿ ಗಿಡ್ಡೆ ಸೇರ್ಕೊಂಡಿದ್ದ ತ್ರಿಫಲದಲ್ಲಿ ಗೊತ್ತಾಗಲ್ಲ, ಮಿಸ್ ಆಗಿರುತ್ತೆ. ಸೊ ಎವ್ರಿಥಿಂಗ್ ವಿಲ್ ಕಮ್ ಬೈ ಪ್ರಾಕ್ಟೀಸ್. ಸೊ ಯು ಕ್ಯಾನ್ ರಿಮೆಂಬರ್ ಅಷ್ಟವರ್ಗ ಕಷಾಯ, ಅಷ್ಟವರ್ಗ ಕಷಾಯ ಪ್ರತಿದಿ ದ್ರವ್ಯ in case of rejuvenation, tissue rejuvenation. So Vatahara, Russia action, you can expect good with Ashtavarga. So testicular atrophy, so low count, if you want to increase the semen count also, we can use Ashtavarga. So very good drugs. So Meda, Mahameda, Kakolik, Shirakakuli, Jivaka, Rushavaka, Ruddhi and Ruddhi. So next level question in Ashtavarga is, they will ask about Pratinidhi Dravya according to Bhaprakasha. So Ashtavarga Dravyas will come in Aditakyadi Gana, Aditakyadi Varga Del Bharata Ashtavarga, these drugs. So Meda and Mahameda, Pratinidhi Dravya is Shatavari. Meda and Mahameda, Pratinidhi Dravya is Shatavari. Meda and Mahameda, Pratinidhi Dravya is Shatavari. Kakolik Shirakakoli. Kakolik Shirakakoli. Pratinidhi Dravya is Ashwagandha. Kakolik Shirakakoli. Pratinidhi Dravya is Ashwagandha. Jivaka Rushabaka. Jivaka Rushabaka. Pratinidhi Dravya is Vidari Kanda. Ruddhi Ruddhi. Ruddhi and Ruddhi. Varahi Kanda. Almost more than 50 times asked about Ashtavarga Pratinidhi Dravyas in previous exams. More than 50. Okay. ನಿಮ್ಗೆ ಯಾವುದೇ ನ್ಯಾಷನಲ್ ಪಿ ಜಿ ಪೇಪರ್ ಅಲ್ಲಿ ಎಲ್ಲಾರ ಒಂದ್ ಕಡೆ ಇರುತ್ತೆ. ಯು ಪಿ ಎಸ್ ಸಿ ಎಕ್ಸಾಮ್ಸ್ ಎಲ್ಲ ನೋಡಿದ್ರೆ ಅಷ್ಟವರ್ಗ ಪ್ರತಿನಿಧಿ ದ್ರವ್ಯ ಇಸ್ ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಎಫೆಕ್ಟಿವ್ ಇನ್ ದ್ರವ್ಯ. ಪ್ರತಿನಿಧಿ ದ್ರವ್ಯದಲ್ಲಿ ಅಂತ ಬಂದಾಗ ಅವ್ರ ತಲೆ ಅಲ್ಲೇ ಹೋಗುತ್ತೆ. ಅಷ್ಟವರ್ಗ ಪ್ರತಿನಿಧಿ ದ್ರವ್ಯ. ಮೇಘ ಮಹಾಮೇಧ ಶತಾವರಿ, ಕಾಕೋಲಿ ಕ್ಷೀರ ಕಾಕೋಲಿ ಅಶ್ವಗಂಧ, ಜೀವಕ ಋಷಭಕ ವಿದಾರಿ ಕಂದ, ವೃದ್ಧಿ ವೃದ್ಧಿ ವರಾಹಿ ಕಂದ. So you should remember Ashtavarga Pratinidhi, Ashtavarga Kashaya, Ashtavarga Dravyas as a rejuvenator. So modern ಅಲ್ಲಿ multivitamins, multiminerals ಹೆಂಗೆ co-prescription ಕೊಡ್ತಾರಲ್ಲ ಅದೇ ತರ ನೀವು ಕೂಡ you can advise Ashtavarga as your co-prescription for rejuvenation, strengthening, weight gain, muscle gain. Okay, so ಎಲ್ಲದಕ್ಕೂ ಯೂಸ್ ಮಾಡ್ಬೋದು ಅಷ್ಟವರ್ಗ. ಕ್ಷೀರತ್ರಯ ಅಲ್ಲ ಕ್ಷಾರತ್ರಯ, ಯವಕ್ಷಾರ ಸಜ್ಜಕ್ಷಾರ ಟಂಕಣ. ಕ್ಷಾರತ್ರಯ ಇಸ್ ಯವಕ್ಷಾರ ಸಜ್ಜಕ್ಷಾರ ಟಂಕಣ. ಕ್ಷಾರದ್ವಯ ಯವಕ್ಷಾರ ಸಜ್ಜಕ್ಷಾರ, ವಿಚ್ ಇಸ್ ಕಾಲ್ಡ್ ಕ್ಷಾರ ರಾಜ. ಯವಕ್ಷಾರ, ಯವಕ್ಷಾರ ಇಸ್ ಕ್ಷಾರ ರಾಜ, ಕಿಂಗ್ ಆಫ್ ಕ್ಷಾರಸ್. ಕ್ಷಾರ ಪಂಚಕ ಯವಕ್ಷಾರ, ಸಜ್ಜಕ್ಷಾರ, ಫಲಶ, ತಿಲ. Tankana, Sharapancha. Okay. Uh, when we have a patient of renal calculi, the ksharas are alkalis. Many a times the renal calculi is dominant of acid. The calcium stones, oxalate, cystine stones form. So in that level, the basic available drugs, it's a kapha dominant one, and it's in hard stone formation. So at that time, we should use an alkalis, the ksharas, to dilute the stone along with some sneha. Okay, Kshara with Sneha is the password and Chikitsa Siddhanta you should remember to destroy the calculi in the body. Got it? So just go through the etiology of formation of these Ksharas. At least you will get in any patients whether they're having a hypothyroid or they're having any issues with the liver. Two things. Otherwise, they're having some low intake of water and other hormonal changes. Majorly will get the improper functioning of the liver, one thing, and hypothyroid. These patients only having a recurrent calculitis. Okay, so if you're giving sneha with kshara, in the same time we will correct the functions of the liver also, and sneha will soften the stone, and kshara will destroy the stone. Opposite to the acid is alkali. These ksharas will dilute the stones, and stone will come out from the area. So in your clinic, we can advise possible kshara. How many ksharas we have, we can mix it and can give to the patient. We have 2 kshara, 3 kshara, 5, 6, 8. The number of ksharas, whatever you have, we can advise. The more number of ksharas, the action will be very good. The stone will come out very fast. And then you should remember one more drug is Ingu. Ingvastaka Churna, Ingvastaka Vati, Ingvadi Churna, Ingvachadi Vati. So the Ingu having a very good role in correcting internal agni of liver and as well as Grahani. So according to Acharya Sushruta, the urine formation will be there in Grahani and excretion through kidneys. According to the modern, so the kidneys will going to filter the toxins from the blood and it will come out. Here, one determination, one demarcation you should make it out is, so when the toxins will come out through the feces or some other route, there will be no toxins will be available to excrete, or these toxins will not come and stay in the kidney to form the stone. So if they consume, if they correct the agni in liver and as well as in grahani, so majority of these toxins will go through the feces. The correction and the pathology is in liver and grahani. Okay, so kidney lagatakanta stone, we need to clear the stone in the kidney. That is the one target. Apart from that, we need to reverse the samprapti. We need to reverse the samprapti of ashmari. Where to reverse? We have to reverse in grahani and yakrut. Kidney medicine ko try it won't reverse. For reversing, the best password, the best drug is Ingu. And Datvagni Manda should be corrected and Dhatu Mala should be excreted by using Aragyavardi. Gratita Mala, Aragyavardi. And as well as Mala is in liquid form, so Tapyadilo. Simple medicines, we can treat the diseases of Ashmar. So now 18 mm, 16 mm. Calculi present inside the kidney, lower calculus 18 mm. Break ಆಗುತ್ತೆ, break piece ಆಗಿ ಹೋಗುತ್ತೆ. So urethra size ಬರೀ 8 mm ಇದೆ, ನೀವು 18 mm calculi, how you treat? Will not excrete the stone of 18 mm. Will break the stone into fragments and it will come out. So that can be done by utilizing your yukti and ashmaris. So that treatment becomes easier if you plan correctly. If you understand pathophysiology of the disease correctly, the treatment becomes easy. Okay. So, Rogi Pariksha and Roga Pariksha is important. While examining the Rogi Rantaratmena Anupravishat, then only we can diagnose. We need to enter inside the Rogi Antaratma. Antaratma means we cannot enter into the mind and Atma of a Rogi. Here, symbolically, Acharya has said that we should inquire in detail about their pathophysiology, body mechanism, body metabolism, everything you should understand. Then only you should prescribe a medicine. Disease pathophysiology, patients, ahara vihara, everything, Yetu, Nidana, everything you should understand, analyze, then come to some conclusion. Then you have to prescribe the medicine. Okay. The Ashwari treatment will start from the Grahani. Ashwari treatment will start from Ekrut. And if it is thyroid, Mamsagata Vikara. Ashmari and Mamsagata Vikara. Again, you will ask question. So where is Mamsa, where is Ashmari? So about creatinine. Where creatinine will produce in the body? Creatinine is the byproduct of muscle metabolism. Okay. So after metabolism of muscle, the toxin is creatinine. If muscle mass is very less, there will be no production of creatinine. So in CKD patient, chronic kidney disease, the kidney failure or kidney loss, in that patient, the creatinine levels is increases. Cannot take out creatinine through urine route because kidneys are not functioning. Both kidneys contains 10 lakh nephrons. At 1 million. Okay, so both kidneys contains 10 lakh nephrons. All 10 lakh nephrons are dead means we cannot do anything. So first and foremost advice given to the patient is to reduce their muscle mass so that the creatinine will reduces. Muscle mass 50% ಕಡಿಮೆ ಆಯಿತು ಅಂತಂದ್ರೆ the patient will be dialysis in time period that can be reduced to 50%. So usually patient will go to dialysis thrice in a week means if muscle mass is reduced, then we can advise dialysis once in a week or twice in a week. So this is the key. So we need to work in reverse manner. So Yamakshara Gokshara we can use. It will take out maximum amount of creatinine through the urine. Okay. If Nitya Virechana is advised, most of the toxins will go through the feces. Okay. So muscle mass must be reduced. In this way, we can think about the reduction of creatinine. And one more method, we have a 3 malas in our classes. Any toxins in the body can be take out from these 3 routes. One is Mutra, second one is Purusha, third is Sweta. So one more password Acharya has given to take out toxin from Sweta. If the patient is having chronic kidney failure, chronic kidney disease, we can advise the patient to take Nitya Abhyanga with Bilvataika. Okay, along with Avagaha Svedana. So power, the muscle strength is very less. We cannot do Nadia or other Svedas. Avagaha Sveda. So then most of these toxins will come out by Avagaha Sveda. So Avagaha Sveda is nothing but a diffusion mechanism. The toxins will move from higher concentration to lower concentration. In Avagaha Sveda, just put some Sainolavana. So Avagaha Sveda is nothing but a tub bath. So this is about the treatment of chronic kidney disease. Kidney rejuvenate ಮಾಡ್ತೀವಿ, ಕಿಡ್ನಿ ಉತ್ಪತ್ತಿ ಮಾಡ್ತೀವಿ, ಇದು ಯಾವುದೋ ಮೆಡಿಸಿನ್ ತಗೊಳ್ಳಿ ಕಿಡ್ನಿ ರಿಪೇರಿ ಆಗಿಬಿಡುತ್ತೆ. Just give up all these thoughts first. ಇರೋದನ್ನ how to tackle the present disease in a present condition, in a present patient. These are all the things we can do. We can practice. Okay. So one level you are now good in treating Ashmari and as well as CKD. So I'll give you the hints and how we can tackle. These are the methods we will advise. So remaining things you can imagine and you can practice. Day by day if you practice, you will get to know about these things. This is my 12 years of experience. What I am sharing with you is my 12 years of experience in treating patients. Okay, ಅಲ್ಲೇ ಇರುತ್ತೆ, ಅದು ಕೊಡಕ್ ಬರಲ್ಲ ಅಷ್ಟೇ. ನೀವು ಕೇಳಿ ವಿ ಹಾವ್ ಗೋಕ್ಷೂರ, ವಿ ಹಾವ್ ಯಾವಾಕ್ಷಾರ ಇದೆ, ಕೊಡಕ್ ಬರ್ತಿಲ್ಲ ಅಷ್ಟೇ. ಯಾವಾಗ ಕೊಡಬೇಕು, ಏನ್ ಕೊಡೋದು. ಬಿಲ್ವ ತೈಲ ಇದೆ, ವಿ ಆರ್ ಯೂಸಿಂಗ್ ಬಿಲ್ವ ತೈಲ ಇನ್ ಕನ್ನಡ ರೋಗ, ಬಟ್ ಬಿಲ್ವ ತೈಲ ಇಸ್ ಎ ಗುಡ್ ಡ್ರಗ್ ಆಫ್ ಚಾಯ್ಸ್ ಇನ್ ಟ್ರೀಟಿಂಗ್ ಸಿಕೆಡಿ, chronic kidney disease. That we need to think. Okay, so any disease and any of these chronic illnesses definitely we can maintain. In our classics also very clearly they are given sadhya, asadhya and yapya. So asadhya rogas we can make it yapya. So yapya rogas we can make it sadhya. So this is there in the hands of a physician. ಅಸಾಧ್ಯನ ನಾನು ಕ್ಯೂರ್ ಮಾಡ್ತೀನಿ ಅಂತ ಹೇಳಕ್ಕಾಗಲ್ಲ. We can maintain ಅಲ್ಲ for certain time. We can give quality life to the patients. ಅವರು 3 days once or 2 days once dialysis ಹೋಗೋ patients life expectancy is not so much. So liquid imbalance ಆಗುತ್ತೆ, electrolyte imbalance ಆಗುತ್ತೆ. So patient may have effusion in the lungs, lung pleurisy ಆಗುತ್ತೆ, pleural effusion ಆಗುತ್ತೆ, ascites ಆಗುತ್ತೆ. Electrolyte imbalance agi patient will go to congestive cardiac failure and patient may die because of cardiac arrest. That will be the easiest way, easiest complication will happen in dialysis patients. Okay, that we can maintain. Nimge adane 2 dialysis, 3 dialysis, now we can make it 2 dialysis, this patient is in comfortable stage. That we can make with our concepts in Ayurveda. We can utilize. Okay. ಅಷ್ಟವರ್ಗದಿಂದ ಸ್ಟಾರ್ಟ್ ಆಯ್ತಾ ಇದೆಲ್ಲ. ಯಾವ್ದಾಗಿತ್ತಪ್ಪ? ಕ್ಷಾರ 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 ಇರ್ತಾ ಇದೆ. ಸೊ ಕ್ಷಾರ ಇಂದ ಸ್ಟಾರ್ಟ್ ಆಗಿದೆ. ಸೊ ವಿಷ, ಮಹಾವಿಷ, ವಿಷವರ್ಗ ಇಸ್ ಮಹಾವಿಷ ಅಂಡ್ ಉಪವಿಷ. ಪರ್ಣದ್ವಯ, ಮುದ್ಗಪರ್ಣ ಅಂಡ್ ಮಾಷಪರ್ಣ. ಪರ್ಣದ್ವಯ, ಮುದ್ಗಪರ್ಣ ಅಂಡ್ ಮಾಷಪರ್ಣ. ಮಹಾಸುಗಂಧ ದ್ರವ್ಯ ಚಂದನ, ಅಗರು, ಕುಂಕುಮ, ಕರ್ಪೂರ, ಕಸ್ತೂರಿ. ಚಂದನ, ಅಗರು, ಕುಂಕುಮ, ಕರ್ಪೂರ ಅಂಡ್ ಕಸ್ತೂರಿ. ಮಹಾಸುಗಂಧ ದ್ರವ್ಯ. ಅಧಪುಷ್ಪ, ಚಂದನ ಅಂಡ್ ಕುಂಕುಮ ಅಂತ ಅಧಪುಷ್ಪ. ಸುಗಂಧ ಮಾಲಕ ಅಂತ ಒಂದು ಗ್ರೂಪ್ ಇದೆ, ಸುಗಂಧ ಮಾಲಕ. ಸೊ ಇದ್ರಲ್ಲಿ ಇರ್ತಕ್ಕಂಥ ಡ್ರಗ್ಸ್ ಎಲ್ಲ ಸುಗಂಧ ದ್ರವ್ಯ ಸೇರುತ್ತೆ. ಫಾರ್ ಎಕ್ಸಾಂಪಲ್ ಜಟಮಾಂಸಿ, ಮೂರ್ವ, ಶುಂಠಿ, ಮುಸ್ತ, ಹರಿದ್ರ, ಏಲ, ಕುಷ್ಟ, ಮುಸ್ತಕ, ಟಗರ, ಶೈಥಿಲಿ, ಇದೆಲ್ಲ these flowers or fruits, these plants having a very good and pleasant odor. Sugandha malakas. Okay. One separate branch of medicine is there. So they will treat the disease with Sugandha dravyas. Somebody will be pleasant for these medicines. So they will treat the disease with these Sugandha dravyas. And even the musta present in Bangalore, the grown in area is having different odor and flavor. In the Himalayas and some other places, it has different flavor and odor. So always we have 2 varieties. One is Gramya and one is Vana. What we grow in the fields is different. What we get in the forest is different. Okay. So in vegetables also we'll see 2 to 3 varieties. One is hybrid, one is natural, nati. Like that. The flavor nuts will be very high in natural habitat. That plants are grown in a natural habitat. There the flavonoids is very good. So some branch they will treat, some doctors they will treat the disease only with these flavonoids. Daily ಅವರು ಕಷಾಯ ಮಾಡ್ಕೊಳ್ಳಿ ಕುಡೀರಿ ಅಷ್ಟೇ. ಸೊ ಆಟೋಮ್ಯಾಟಿಕ್ ಕಡಿಮೆ ಆಗುತ್ತೆ. It will pleasant only. So mind will heal. Okay. ಲವಣ, ಲವಣ ಪಂಚಕ, ತ್ರಿಲವಣ, ಚತುರ್ಲವಣ, ಪಂಚಲವಣ. Okay. So Lavana means Saindava Lavana. Only one Lavana is Saindava Lavana. Pancha Lavana is Saindava, Savarchala, Vida, Samudra. Okay, these Lavanas. Madhuratraya, Sharkara, Madhu, and Gruta. Sharkara, Madhu, and Gruta, Madhura Traya. Trigandaka. So Gandaka Ratala Manashila. Triloha, Swarna Rajatan Tamra. Triloha, Swarna Rajatan Tamra. Okay, so this is about Mishraka Ganas. Almost major Mishraka Ganas we have discussed. Okay, so just remember the Mishraka Ganas and they may ask you one or two questions from Mishraka. Okay, so next important topic in Dravya is Guna. Okay, so take 2 minutes break. We'll start Guna. Okay, 2 minutes break. Again, we will resume Guna. Close, close. Okay, we'll start with okay. In the definition, samavaitu nishcheshtaha karanam gunaha. So nirgunastu gunaha swatahu. Sushruta, in Sushruta we have guna is called as nirguna. Okay. So while studying in Padartha Vijnana, guna is nirguna, nishkriya, vishwalakshana. Three characters, three main characters you should remember in case of guna. So guna is nirguna, nishkriya, vishwa lakshana. So guna is having a samavai sambandha in dravya. Okay. So guna and karma both having samavai sambandha in dravya. So dravya is nothing but guna and karma, but guna is one in the dravya which is having samavai sambandha. Samavaitu nischeshta karanam guna. Charaka Sutra. So remember the shlokas as it is with the shloka reference. So nirgunastu gunaha smrutaha. So Sushruta Sutra 40th chapter 17th shloka. So guna is nishkriya, nirguna, vishwadakshara. So these three terminologies you should remember. So nishkriya means without dravya, guna will not having its existence. Okay, alone guna won't do anything. With the dravya only it will do karma. Okay, Shita. Shita antakshna in our life. Dravya is Shita, then it guna will do stambana. Guna is present, Shita guna is present in Shita dravya, then the Shita dravya will do stambana. Alone Shita won't do anything. That's why it is nishkriya. Guna is nirguna. So nirguna means guna doesn't want any other guna to explain its guna. ಇದು ಶೀತ ಅಂತ ಹೇಳಕ್ಕೆ ಬೇರೆ ಯಾವುದೋ ಗುಣ ಬಂದು ಶೀತ ಅಂತ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಕ್ಕಾಗಲ್ಲ. So guna doesn't need any other guna to explain its guna. That's why it is nirguna. Shita is Shita only. We need to understand. Ushna is Ushna only. So Shita should be understood by the effect as a stambana. Ushna has to understand by its effect as svedana. So that's why it is nirguna. Guna is nishkriya, alone it won't do anything. Guna is nirguna. Guna doesn't want any other guna to explain its guna. Because everything is guna only. ಬೇರೆ ಗುಣ ಈ ಗುಣನ ಹೆಂಗೆ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಕ್ಕಾಗುತ್ತೆ? ಅದರ್ ಗುಣಾಸ್ ವಾಂಟ್ ಎಕ್ಸ್ಪ್ಲೇನ್ ದ ಗುಣ ಆಫ್ ದ ಪರ್ಟಿಕ್ಯುಲರ್ ಡ್ರಗ್. ಸೊ ಹಂಗಾಗಿ ಗುಣ ಈಸ್ ನಿರ್ಗುಣ ಅಂಡ್ ಆಸ್ ವೆಲ್ ಆಸ್ ನಿಷ್ಕ್ರಿಯ. And it is a Vishwa Lakshana. Guna is a universal truth. Okay, so anywhere in the universe, Guna is same. Shita, everywhere Shita is same, everywhere Ushna is same. So all Guna is same everywhere. That is Vishwa Lakshana. It's a universal truth. So Guna won't change in USA, Guna won't change in Bangla, Guna won't change in everywhere. Everywhere Guna is same. Guna is Nirguna, Nishkriya and Vishwalakshana. These two terms we should understand. So Guna will have some Samvaya Karana with the Dravya. Okay. So and then total number of Guna classification, there are total 41 Gunas in total explained in the classics. Out of that, Guruvadi Gunas are 20. So Paradi Gunas are 10. Atma Gunas are 6. Vishesha Gunas are 5. So in total, the Gunas are 41 in number. So Guruvadi Gunas are also called as Sharira Gunas. Gurumanda Imasnigda, Slakshna Sandra, Mrudu Stira. So the opposite ಇರ್ತಕ್ಕಂಥ gunas. These gunas are called as Guruvadi gunas. These gunas are also called as Sharira gunas. Okay. So and then Paradi guna, Para Aparatva Iktischa, Sankhya Samyoga Yocha, Prutakascha Vibhagascha Parinamita Chapi, Samskara Abhyaso Gunaha, Paradaya. There are 10 Paradi gunas. Guruvadi gunas are 20, Paradi gunas are 10, Vishesha gunas ಯಾವುದು ವಿಶೇಷ ಗುಣಾಸ್ ಆರ್ ಪಂಚತನ್ಮಾತ್ರಾಸ್. ವಿಶೇಷ ಗುಣಾಸ್ ಆರ್ ಪಂಚ ತನ್ಮಾತ್ರಾಸ್. ಪಂಚತನ್ಮಾತ್ರಾಸ್ ಯಾವ್ದು? ಶಬ್ದ ಸ್ಪರ್ಶ ರೂಪರಸ ಗಂಧ ಆರ್ ಕಾಲ್ಡ್ as ಪಂಚ ತನ್ಮಾತ್ರಾಸ್. ಅಂಡ್ ದೆನ್ ಆತ್ಮಗುಣಾಸ್ ಸುಖ ದುಃಖ ಇಚ್ಛಾ ದ್ವೇಷ ಪ್ರಯತ್ನ ಬುದ್ಧಿ. There are 6 Atma Gunas. It's also called as Adhyatmana. Adhyatma Gunas are 6 in number. Sukha, Dukkha, Ichcha, Dvesha, Prayatna, and Buddhi. So Vishesha Gunas are 5 in number. It's also called as Panchatanmatra, Shabda, Sparsha, Rupa, Rasa, Gandha. And Paradi Gunas are 10 in number. Paraparatvettischa, Sankhya Samyogayocha. Then Mikid. ಶ್ಲೋಕ ಮಾಡೋದೆಲ್ಲ ಮರ್ತು ಬಿಟ್ಟಿದ್ದೀರಲ್ಲ. ಸಂಸ್ಕಾರ ಅಭ್ಯಾಸ ಇದು ಪುನಃ ಪರಾದಯ. ಸಂಸ್ಕಾರ ಅಭ್ಯಾಸ. ಪರ ಅಪರತ್ವ ಯುಕ್ತಿಶ್ಚ ಸಂಖ್ಯೆ ಸಂಯೋಗ ವಿಭಾಗ ಪ್ಲುತಕಚ್ವ ಪರಿಣಾಮ ಸಂಸ್ಕಾರ ಅಭ್ಯಾಸ. There are 10 paradi gunas. So guru manda imasnigna shlakshna sandra mrudu stira. So opposite guna to guru is lagu. Shita Ushna, Snigdha Ruksha, Manda Tikshna, Shlakshna Kara, Sandra Drava, Stira Sara, Stula Sukshma, Pichila Vishada, Mrudu Katina. So these are all gunas total, 41 gunas. Here the question they will ask you is not about this. So main question they will ask you about Vishada will brings about, Pichila will brings about, Shita will brings about. Okay, so every guna will have its most important effect in the body or most important action in the given area, that is its karma. Okay, yasya stambana shakti sa shitah, स्वेदना शक्ति सा उष्णः, ब्रह्मणे गुरुः, लंघने लघुः. ओके, क्लेदना शक्ति सा स्निग्धः, शोषणे रूक्षः, शमना शक्ति मंदा, मंदस्तु शमना शक्ति, शोधना शक्ति तीक्ष्ण, तीक्ष्ण गुण will have Shodhana effect in the body. Dharana Stira, Sara Prerana, Prerana Shakti sa Sara, Mrudu Shlatana, Katina Drudhikarana. Okay, Vishada Kshalana. So each Kshalana Sumasula Kelila. So Vishada will brings about Kshalana in the body. Shalana will have an action of Vatakara. So Pichila Lepana. Lepane Pichila. Lepana will do Pichila. Even Snigdha will also do. All Snigdha dravyas or Sneha will have a Pichila. Shlakshna will do Ropana. Kara Lekana. Sukshma Vivarana. Stula Samvarana. Sandra Prasada. Drava Viloda. Okay. The thing you need to memorize is important action bring about by the good of ಗುರುವಾದಿ ಗುಣ. ಸೊ ಫಸ್ಟ್ ಪಾರ್ಟ್ ಏನು ನೆನಪಿರುತ್ತಲ್ಲ, ಗುರು ಮಂದ 20 ಗುಣಾಸ್ ಯಾವ್ದಂತ ಗೊತ್ತಿರುತ್ತೆ. ಫ್ರಮ್ ಫಸ್ಟ್ ಇಯರ್ ಬಿ ಎಂ ಎಸ್ ಟು ಫೈನಲ್ ಇಯರ್ ಬಿ ಎಂ ಎಸ್ ಯು ವಿಲ್ memorize the same thing and it is easily remembered. ಗುರುವಾದಿಜ್ಞ ಪದಾರ್ಥ ವಿಜ್ಞಾನ 2-3 ಸಲ ಬರ್ದಿರೋರ್ಗಂತೂ ಆರಾಮಲ್ಲಿ ನೆನಪಿರುತ್ತೆ. ಓಕೆ, ಸೊ ದೆನ್ ಪರಾದಿ ಗುಣ. ಸೊ ಪರಾದಿ ಗುಣದಲ್ಲಿ ಕೂಡ ಒಂದ್ ಸ್ವಲ್ಪ ನೆನ್ಪಿಟ್ಕೊಂಡ್ರೆ ಬೆಟರ್. ಸೊ ಸೊ ವಾಟ್ ಈಸ್ ಸಂಖ್ಯಾ? ಸಂಖ್ಯೋ ಈ ಗಣಿತಶಾಸ್ತ್ರ. ಸಂಖ್ಯಾ ವಿ ಆರ್ ಯೂಸಿಂಗ್ ದ ಮ್ಯಾಥಮೆಟಿಕಲ್ ಕ್ಯಾಲ್ಕುಲೇಷನ್ಸ್ ಇಟ್ಸ್ ಕಾಲ್ಡ್ as ಸಂಖ್ಯಾ. Okay, so what is paratva? So para is pradhana or shrestha. Okay, so para means pradhana, most important, shrestha, superior. So that it's called as para. So ಶ್ಲೋಕದಲ್ಲಿ ಬರುತ್ತೆ ನೋಡಿ, ನಿರ್ವಿಕಾರೋ ಪರಸ್ಯ ಆತ್ಮ ಸತ್ವಭೂತ ಗುಣೇಂದ್ರಿಯ ಚೈತನ್ಯಂ ಕಾರಣಂ ದ್ರಷ್ಟ ನಿತ್ಯ ಪಶ್ಯತಿ ಇತಿ ಕ್ರಿಯಾ. So here ನಿರ್ವಿಕಾರ ಪರಸ್ಯ ಆತ್ಮ means para means shrestha, are important, are superior. So yeah, given a most important place to the particular thing, that is para. Apara is apradana, it's not superior, not important. Okay, para para yukti, logical thinking, logical understanding. Okay, so that is yukti. Sankhya hi ganita jnana. The numberings, mathematical calculations, what we are doing is sankhya. Samyoga, unity. So mingling or jodana, what you can call as samyoga. Dividing is vibhaga. Pruthakatva asamyoga, we cannot unite it, it is pruthakatva. Part by part, part we will divide, that is pruthakatva. So parinama, transformation. Parinama is kala, parinama is transformation. Samskara, samskaro hi guna antardana. So that will add effects to the body. So agni samskara, what you can call, if boiling means we are giving agni samskara. So we are triturating the things means we are doing the bhavana to the drug, it is also samskara. Samskara is one thing, so it will change the originality. Samskara is gunantardana. Okay. Abhyasa means repetition, repeated reading, the repeated practicing is called as abhyasa. This is about 10 paradi gunas. Okay, so vishesha gunas are 5 vishesha gunas we have, shabda sparsha viparasaganda. And come to adhyatma guna. So usually you will forget about prayatna, sukha dukkha ichcha dvesha, you will remember. So buddhi and prayatna you will forget. Buddhi is also atma guna. Buddhi many a times you will keep it in aparaguna. Okay, so paragunadalli ಹಾಕ್ಬಿಡ್ತೀರಾ ಬುದ್ಧಿನ. So buddhi is atma guna, paradi gunadalli ಹಾಕ್ಬಿಡ್ತೀರಾ ಬುದ್ಧಿನ. So prayatna ಕೂಡ you will keep it in paradi guna. Buddhi and prayatna are atma gunas. So question will be very clear, which among the following is not a paradi guna, or which among the following is a paradi guna. So like that direct question they may ask. Or numbers ಅಂತೂ dead easy question ಕೇಳಲ್ಲ, ಅವರು ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ. Total number of gunas are 41, 20 plus 10 plus 5 plus 6. So in atma gunas you should remember, so buddhi and as well as prayatna, sukha dukkha ichcha dvesha, prayatna and buddhi. So ಇದರಲ್ಲಿ ಕೂಡ ನೀವು ಡೆಫಿನೇಷನ್ ನೆನ್ಪಿಟ್ಕೊಂಡ್ರೆ ಒಳ್ಳೇದು. ವಾಟ್ ಈಸ್ ಸುಖ? ಸರ್ವ ಅನುಕೂಲ ವೇದನೀಯ ನಾಂ ಸುಖ. Whatever the anukula vedaniya is sukha. So if we are doing the things comfortably is sukha, for achieving something. If it is difficult also we will do it, that is sukha. So we are preparing for AIPGT for a purpose. We have one aim, that is our purpose of present year. That is the purpose we are doing it. With lot of difficulties also we are doing it. So ultimately we will get a seat in good college with good branch, that is sukha. Sarva Anukula Vedaniyanam Sukham. Sukha is not only happiness or enjoyment or other things. So the what definitions given by our acharyas, darshanikas for the sukha is most important. Sukha is not only drinking something else or eating some good food stuffs. It's not sukha. Simply enjoying is not sukha. So achieving something with the pain is also a sukha. We are giving something, we are achieving something with a pain, and it's an anukula vedana is sukha. So dukkha, Acharya has given same ulta definition. So sarva ananukula vedaniyanam dukkha. So buddhi is an intellect, intellectual power. So the decision power, determination power, what we have in the brain is buddhi. Okay. Icha is what our likings is icha. Again for icha also he has given the borderline. So ichas with our limits is an icha. So nan Chandra ಬೇಕು nan ಮಂಗಳ ಗ್ರಹಕ್ಕೆ ಹೋಗ್ಬೇಕಂದ್ರೆ so it won't be happen. So ichas with your limits. ದ್ವೇಷ ಪ್ರಜ್ವಲನಾತ್ಮಕಂ ದ್ವೇಷಃ. ನೋಡಿದ್ರೆ the blood will blown up, the blood flow will rushes out of from the heart. So so a normal blood flow in a minute is 5 liters. If you in a dvesha conditions, the blood flow will be more than 10 liters. That is prajwalanatmakam dvesha. You will get anger, you will get hatredness. That is dvesha. Prajwalanatmakam hi dvesha. So prayatna is an effort. What effort we are doing to getting something or achieving something. So that is prayatna. All these gunas are inherited by Atma. So these gunas will incorporate into their body after entering of the heart. Shukra Shuneta Samyoga, Atma will enter during Shukra Shuneta, then Jiva will come to the Bruna. Then the Jiva starts. Chetana, multiplication starts in the womb. Okay. So there only Atma will start. From Atma will bring these gunas to the body. So once body die means there is no these functions. If the person is living means he must have all these characters. You can tell these are all the living characters of a person. ಯಾರಿಗೂ ನನಗೆ ದ್ವೇಷನೇ ಇಲ್ಲ, ನನಗೆ ಇಚ್ಛೆನೇ ಇಲ್ಲ, ನನಗೆ ಸುಖ ಅಂದ್ರೆ ಏನು ಅಂತ ಗೊತ್ತಿಲ್ಲ ಅಂತಂದ್ರೆ ಈಸ್ ಎ ಡೆಡ್ ಪರ್ಸನ್. Okay. So when we are living with an Atma means we have all these characters. We must have an intellect. We have to put efforts in getting something. We must have some likes. We must have some dislikes. So we will enjoy the happiness. So we will also enjoy dukkha. So the human being is having all these characteristics. These characteristics are inherited by Atma. There are 6 Atma gunas, inherited characters to the human body. Okay, Sukha, Dukkha, Ichha, Dvesha, Buddhi, and prayer. So here in the APGD point of view, you should remember Buddhi and as well as prayer. So these two they must be in APGD. Okay. So why guna is pradhana? So first we are given dravya pradhana, vikalpa samarthya. So adhikya dravya is pradhana. So this is according to Nagarjuna ಒಂದು ಹೇಳಿದ್ವಿ. Then Charakad ಒಂದು options ಹೇಳಿದ್ವಿ. ಬಹುಕಲ್ಪ ಬಹುಗುಣ ಸಂಪನ್ನಂ ಯೋಗ್ಯ ಮೋಕ್ಷದ. So like that, the why guna is superior. Rasabhibhava, rasana guna, vipaka karanam, upadesha karanam, vyavahara karanam, anumana karanam. So they are given some reasonings why this rasa guna is dominant. Is it my important? So just note down there are 10 properties given by Acharya Nagarjuna for gunas. 10. There are 10 characteristic features given by Nagarjuna for the superiority of gunas. From rasabhibhava, rasanugraha, vipaka karana, sankhya bahula, prayoga bahula, karma bahula, vishaya bahula. It's visible in PDF. Just check it out. We'll share you in the group. Okay. So this is about guna. Okay. We'll continue for another half an hour. No, Shala? Onliners get tired agala. They will with class only they will drink, eat. They have all the options. For offliners only it's bit embracing or irritation. Anyway, we'll continue. So Rasa, so in Charaka Samhita, maybe 19th chapter, Rasa nipete dravyam ipakam karma nishtaya. So in explanation of the Rasa, Acharya Charaka has given a simple definition for Rasa. So that will come in contact with tongue or with jivha. We can able to identify the things. It's called as Rasa. Okay. So Rasa is the one thing that we can able to identify its characters when it come in contact with the jivha. ಇಲ್ಲ ಹೆಂಗ್ ಗೊತ್ತಾಗುತ್ತೆ ನಿಮ್ಗೆ ರಸ by smell. It's a very clear practical definitions given by Acharya Charaka. Rasa nipete dravyam vipakam karmanishta. So rastanam asvadyate iti rasaha. Here also Charaka Samhita first chapter Chakramani Tika it is. So in practical in Charaka Sutra Sthana 19th chapter maybe 20th chapter maybe 19th chapter. If my memory is correct, it is 19th chapter. Rasa nipete dravyam vipako karmanishta. So something will come in contact with the tongue, we can able to identify. It's called as rasa. Okay, and identification of rasa is a pratyaksha gamya bhava. We can taste it, so it's not anuman. So after it is come in contact with the tongue, we can able to identify. Pratyaksha means, in according to the definition of padartha vijnana, is indriya pratyaksha. So either we can see, either we can taste it, either we can smell it, either we can hear it, or we can do sparsha. So pratyaksha means indriya pratyaksha. Either any one we can perceive the things. It's called as pratyaksha. So rasa is a pratyaksha gamya bhava, and vipaka is anumana gamya. So this is a PGP question. So vipaka is dash. ನೀವು ಪ್ರತ್ಯಕ್ಷ ಅನುಮಾನ ಆಪ್ತಭವಿಷ್ಯ ಯುಕ್ತಿ 4 options going to give, then you will get confusion. Vipaka, it is kriya chapter, question asked in padartha vijnana, and it is also there in dravya guna. So where it will come? This is dravya guna question. Vipaka is anumana gamya bhava. After attaining, after transformation of rasa, then only we will get vipaka. So vipaka cannot be pursued directly. So when it is achieved some karma in the body, so then only we get to know. So this drug will having so and so vipaka, and this drug has done so and so karya inside the body. So vipakam karma nishtayam, and as well as anumana gamya bhava. Okay. So rasa is rasendriya grahana. Vastu is called as rasa. The object perceived through Rasanendriya is called as rasa. This is ashrita in dravya. Rasa is always having an ashraya in dravya. Alone it won't present anywhere in the universe. It has an ashraya in the dravya. Then come to types of rasa. Somya and Agneya, one classification. Vidahi, Avidahi, one more classification. Dosha Shamaka and Dosha Prakopata. So one more classification. Simply go through it. The main types of rasas are shat rasas. So Madhuramla Lavana, Katajitta, Krishna. So this is the most acceptable and universal format of rasas. Yadu. So Madhuramla Lavana and Katajitta, Kashaya. So here the most important AAPGD point in rasa is Rasa Sambhasha Parishad explained in Charaka Samhita Atreya Bhadrakapiya Adhyaya. Okay, the rasas. So according to Bhadrakapya, it is one. So Shakuntena Brahmana, it is two. Purnaksha Modgalya, it is three. Hiranyakshaka, four. Kumarashira Bharadwaja, five. Rajarshi Vayasena, six. Videhanimi, seven. Badishata Margava, eight. Kankayana, Aneka. Punarvasvatraya, finally, yes, given a conclusion. There are only six rasas. So, in this discussion, some acharyas consider Kshara as also a rasa. So, those were given seven rasas. He has given, he added Kshara as one of the rasa. Videha, Nimi. Six rasas plus seventh rasa is Kshara. But Acharya Punarvasu Atraya is given a clarification. Shara is not a rasa. It will share its properties. It will taste with lavada and amla. It is not alone a rasa. So, in total conclusion, in this Sambhasha Parishad is total number of rasas are only six. Okay. So, like one question asked in APGT, Pumsatva Apagatina Shrestha Rasa. Pumsatva Apagatina Shrestha Rasa. Rasa that will do Pumsatva Apagata. Otherly Madura, Amla, Katu, Tikta, Elakoteru, and Kshara also then one. The options are Tikta, Kashaya, Katu, and Mother. Tikta, Kashaya, Katu, and Mother. So, illi very clearly they are given Pumsatva Apagatina Rasa. So, according to this Atre Bhadrakapyadhyaya, Kshara is not a rasa. But in Charaka Agreya, Pumsatva Apagatina Pradhana is Kshara. Okay. So, out of Kshara, other rasa that will do Pumsatva Apagatina is Kat. Shrestha Pumsatva Apagatina rasa is Kat. Katu. According to recent survey, most highest male infertility will noticed Hyderabad. Cities, city-wise disease and other things. So highest male infertility found in Hyderabad. Highest respiratory infections found in Bangalore. Highest asthmatic patients and COPD patients found in Delhi. Highest diabetes and diabetes complication found in Ahmedabad, Gujarat. Okay. So highest musculoskeletal problem found in Bombay. Okay, like that. They are given a survey. So having highest number of diseases. Okay. So then we have find out these peoples will consume a lot of kapul, mirchi, green mirchis and red mirchis. Hyderabad biryani, if you have, go to the Hyderabad or else if you go to the restaurant, will make Hyderabad biryani. Definitely will get to know the katu, katutva of that Hyderabad biryani. It is very katu. So they will add mirchis in highest number. So katu is Pumsatva Pagatina Pradhana Rasa. Kata will going to increase Ushnatva in the body, and Ushnatva will going to harm the spermatogenesis. Okay. So this is the logic behind the highest number of male infertility found in Hyderabad. Irrespective of the religion or particularly, so not only in one religion, it may be Hindu, Christian, or Muslim, or any irrespective of the religion, the male infertility will be highest in Hyderabad with having because they are having Katu Rasa Pradhana aha. They are consuming Katupradhana aha. Okay. So rasa and Panchamahabhuta. So this is very important to just remember the chart rasa and Panchamahabhuta. So in Maharashtra we have one cult of practice, Panchamahabhuta Dravyas. So they will prescribe the dravyas based on Panchamahabhuta. Some of the senior Vaidyas, just by swara only, they will observe your Panchamahabhuta in the body and they will advise medicine accordingly. So with your swara, it looks like Rihina swara Vata Prakopa. Vata Prakopa, Vata Sthanas, what are the Vata Sthanas? Katipusta, Ura. And according to the age and other things, they will identify whether you have a problem with kati or whether you have a problem with knee joint. Then they will directly prescribe the medicines. It's connected, everywhere it's connected. So based on your swara, if it is a very good, strong voice, pitta, melody and strong kapha. So with the swara only, they will identify and they will prescribe medicine according to the ages. It's based on Panchama. Vata Prakopa, then we have to give Madara Amlalavana, Pradhana Rasa Dravyas, and Madara Vipaka Dravyas, Shita Vidya Dravyas, and with where Vata Prakopa based on the sthana. So they will select the medicines. Fix ala. So the prescription in Ayurveda is fixed. The thing is only diagnosis is the problem. Prescription inga madodu. Easy. Thing is we'll fail in diagnosis. So in this way also we can diagnose the disease. So ಕೆಲವೊಂದ್ಸಲ we can see in TV Jyotishya. So in the TV only, instantly they will give you Jyotishya by just listening their voice or just by taking something else. How they will do? So they have some logical thinking behind this. They have learned that logical thinking. Okay. So Panchamabhuta, it's an important effect. You just go through it. Tikta rasa is predominant of Vayu and Akasha. Kashaya rasa is predominant of Vayu and Prithvi. So Tikta Shaka, I told you in Prameha, it is predominant of Vayu and Akashamabhuta. So Prameha is predominant of Kapha dosha. So this Tikta Rasa will opposite to that of Kapha. Jala and Prithvi is the Pachamabhuta of Kapha. So opposite rasa is Tikta Rasa, Vayu and Akasha. We can utilize to decrease Kapha inside the body. Fix ala. Opposite of rasa, opposite of Panchamabhuta. So Panchamabhuta, rasa and guna will meet. So Panchamabhuta and rasa will meet at guna. Guna is also having Panchamabhuta. Rasa is also having Panchamabhuta. Both will meet at the point guna. So this guna theory is the best one. Based on guna, we can practice the medicine. Especially first three gunas. You just check it out. So can you tell me the gunas of Vata? Tatra Ruksha Lagu Shita Karaha Sukshma Sharama Vanila. First three gunas. Tatra Ruksha Lagu Shita. So you just imagine whatever the prescription you will given to the Vata patients. Either it is Ruksha opposite is Snigdha. Lagu opposite is Guru. Shita opposite is Ushna. Ushna, Guru and Snigdha Aushadas. Whatever with Akara also Ushna, Guru and Snigdha. You just think about any drug advice in the patients of Vata, it is predominant of only these three products. And every dosha, first three gunas are important. Based on that, we can plan the treatment. Opposite to the gunas are the planning of treatment. Okay, so Rasa Panchamabhuta should go through in detail, memorize Rasa Panchamabhuta in detail. So it's very important if you just go through in Amla Rasa. So according to Charaka Vagpata Nagar, in development of Prithvi and Agni, and Sushuta it's development of Jala and Agni. Okay, so just go through and just remember based on this Panchamabhuta. So Rasa and Rutu Sambandha, yes. Rasa and Rutu Sambandha is some Rutus will be predominant with some Rasa. So ಯಾವ ಋತುವಿನಲ್ಲಿ ಯಾವ ರಸ predominant ಇರುತ್ತೆ ಅಂತ note down. So just remember the Rutus. Yeah, which is the first Rutu? Shishira Vasanta Grishma, Varsha Sharad, Hemant. Shishira Vasanta Grishma, Varsha Sharad, Hemant. The Rutus. So you should start writing the rasa from downwards. Hemanta, Madura. And then middle rasa is Varsha. Then Lavana. Then Katu, Tikta, Kashaya. So our liners you can observe my cursor. Madura, Amla, Lavana. Katu, Tikta, Kashaya. Katu, Tikta, Kashaya. So here Madura, Amla, Lavana. Like that. Chart we will share. So Rutus you should write like this. Shishirosna Grishma Varshara Remanta. Rasas start from downwards. Madura, Amla again, middle Lavana. Katu, then Tikta in the top, middle Kashaya. Okay, just simply remember this is also important PGT chart. So Rutu and Rasa relation. Some Rutus are predominant of particular Rasas. Rutu Aritaki is based on this thing only. Opposite that of Anupana can be given in Rutu Aritaki. Based on Aritaki, you will get one or two questions. So Aritaki is most important drug in our Ayurveda. So in olden days, in the Panditas or the practitioners are called as Aralekai Pandita. So Aralekai in Kannada it's called as Haritaki. So barefoot botanists. So the Haritaki is the one drug used extensively in the clinical practice. Okay. So the name of the Vaidya is also based on Haritaki. So in our clinical practice, any combination of the drugs. So highest number we can see Haritaki. Okay. So permutation and combination of rasas, there are uh, totally 63 permutation combinations we can make with rasa. Okay, Ekarasa will become 6, Dvirasa 15, 3 rasa 20, Chetu 15, Pancharasa 6, and Shadrasa 1. So like that we can make permutation combination of 63 varieties, 63 types. Permutation combination you can do with rasa. So then question asks, how many days rasa will stay in one dhatu? Uh, it will stay in one dhatu is up to 15 kala, 3015 kala it stays in one dhatu. According to Chadaka, so at least 5 days rasa will stay in one dhatu. It will take 30 days to reach Shukra. Ahara to reach Shukra, it will take 3 days. According to Sushruta, it will take only 1 day. One day it will pass on to other dhatus. So Madhura Amla Lavana Rasa will do Sushta Vinmutra Marata. So proper formation of Purusha, proper formation of Mutra will be achieved by consumption of Madhura Amla Lavana. Kadagita Kashaya will do Mutra Avroda and Purusha Avroda, and it will do Vata Prakopa. So one more clinical clue as given by Acharya Va Prakasha in Naritakya Varga. भोजनाग्रे सदा पिप्पली लवणार्धकम भोजनाग्रे सदा पत्यम लवणार्धकम भक्षणम भोजनाग्रे सदा पत्यम लवणार्धकम भक्षणम. So ardhaka and lavana should be taken in the first course of the meal. That will increase the appetite, that will do amapachana, that will make the food digest very comfortably and easily. So that's why we will make soups. What is the major content of the soups? They will definitely add shunti and lavana. Or else bhavana shunti is available in the market. Any shunti and lavana should be consumed before starting the meal. Best thing is you can make shunti pickles and consume shunti pickle first and then start food. Bhojanagre sadapatyam lavanardaka. So just remember this is the shloka, a clinical clue given by Bhava Prakasha. Okay. So according to Charaka, rasa upalabdhi is through repairs. Rasa nipete dravyam means, so the practically we can feel rasa. Virya upalabdhi. So virya can also be felt, some Ushna virya, Shita virya dravyas, so by coming in contact with it, and some we cannot see virya. Vipaka always a karma nishtaya. We'll perceive vipaka only after the effect of the drug in the body. And prabhava is achintya virya. Prabhava means we cannot imagine. That is prabhava. Prabhava means achintya virya. So and then difference between rasa and anurasa. Rasa will be experienced immediately. Anurasa will be felt after some time. Some of the other tips are there that I just go through that. Rasa based on guna. Charaka Samhita reference. Go through the chart. And then comes rasa pradanyatva. Adhikara, Upadesha, Anumana, again Nagarjuna there. So Anumana, Agama, Upastamba. Just go through it. So this is about rasa. Next, Virya. So Nirukti, Vira Vikranto. The derivation of Virya is, the Virya is Vira Vikranto. Yena Kurvante Tadvirya. Yena Kurvante Tadvirya Charaka Sutra, 26th chapter. Viryetu Kriyate Yena Ya Kriyaha. So and then Virya is Chintya Shakti according to Shivadas. Virya is Chintya Shakti. According to Nagarjuna, Virya is Karma Lakshana. You can think about the Virya of a drug by knowing its rasa, by knowing its guna, by knowing its vipaka. Virya is the potency of a drug. We can imagine and we can think about it and assume about the Virya. Virya is Karma Lakshano Virya. Nagarjuna. Virya is Karma Lakshana, Virya is Chintya Shakti, or else active principle of a drug or the potency of a drug is called as Virya. And most important FAQ in Virya portion is they will ask you about who is the profounder of Shakti Viryavada. Charaka and Chakrapani proposes Shakti Virya Vada. Dravya Viryavada, again Charaka Chakrapani. Guna Viryavada, Parivasha Viryavada, Viryavada is Sushruta Vada. Guna Viryavada and Parivasha Viryavada. Karma Viryavada, Nagarjuna and Bhava Prakasha, Bhava Mishra, Bhava Prakasha. Bokuvida Viryavada, Indu and Hemantri. We'll share you the material. Dvivida Virya, Ushna Evam Shita Virya is only Dvivida Virya. Ashtavida Virya, so Charaka. So based on Guna, he classified Ashtavida Viryavada, Guru, Laghu, Snigdha, Ruksha, Ushna, Shita, Murdu and Tikshna. Sushruta again, Ashtavida Virya. But Sushruta is a little bit different here. Shita, Ushna, Snigdha, Ruksha, Murdu, Tikshna, Pichila. Pichila I added extra. And Vishada. So Ashtavida Viryavada is unique contribution of Charaka and Sushruta. Okay, that you should remember. According to Nimi, there are 15 Viryas. Panchadasha Virya. ಅಧೋಭಾಗಾರ ಉಭಯತೋಭಾಗಾರ ಸಂಶಮನ ಜೀವನೀಯ ಶೀತೀಕರಣ ಶೋತಜ್ಞ ಧಾರಣ ಆ ಥರದ್ದೆಲ್ಲ ಇದೆ ದೀಪನ and along with that they are given Panchamahabhuta also. So if they want to ask a deep question in Dravya Guna, they may ask you, for example, Adobhagahara Dravyas, ಪಂಚಮಭೂತ ಪೃಥ್ವಿ and ಜಲ ಊರ್ಧ್ವ ಭಾಗ ಅಗ್ನಿ and ವಾಯು ಸಂಕ್ಷಮನ ಪಂಚಮಭೂತ ಸಂಕ್ಷಮನ ದ್ರವ್ಯ ವಾಯು ಜಲ and ಪೃಥ್ವಿ ದೀಪನೀಯ ದ್ರವ್ಯ ಪಂಚಮಭೂತ ಪೃಥ್ವಿ and ಅಗ್ನಿ. Okay, like that I may ask the question. We'll share you the material regarding that. Relation between rasa and vipakavada. So madhur rasa madhur vipaka it will attain shita virya. Amla rasa amla vipaka katu rasa katu vipaka and ushna virya. So madhur rasa will attain shita virya. So other vipakas will go to ushna virya. Only madhur rasa will go to shita virya. So amla rasa attains amla vipaka and it is ushna virya. So katu kashaya and tikta rasa will attain katu vipaka and it is also attains ushna virya. Next, virya pradhanatvam, viryam pradhanakatvam, karma karanam, rasavibhava. There are 3 to 4 uh, uh, substantive things given by Nagarjuna. So, things to be remembered in virya is the definitions and who is the profounder of Bhakti Viryavada, how many viryas according to Nimi. Okay, so these things you should go through in virya. Virya is nothing but potency. Virya can be perceived with our senses. It is also pratyakshagamya bhava. Then comes vipaka. So vipakam karmanishtam. So vipaka will be attained when the rasa is come in contact with the jataragni. After a transformation of rasa into secondary metabolite, it's called as vipaka. Okay. So Vishishta Paka is Vipaka, Parinama Lakshanam Vipakam, Vipako Karmanishchayaha. So just go through the definitions. So Vipakavada, there are 2 Vipakavada, Guru and Lagu, 1 and Panchavada Vipakavada based on Panchamavata, Prithvi, Ap, Teja, Vayu and Akasha. Shadvida Vipakavada based on 6 rasas. All 6 rasas will attain 6 Vipakas. Trivida Vipakavada, this is the most acceptable Vipakavada. So told by Charaka Vagbata and Parashara. Madhura Lavana Rasa times Madhura Vipaka, Amla Rasa times Amla Vipaka, Katinda Kashaya times Katu Vipaka. According to Nagarjuna, again 2 Vipakas, Chidakalina Vipaka and Achidakalina Vipaka. So 2 types of Vipakas according to Avastha Veda, Avastha Paka as well as Nishta Paka. So Guna, Karma and Vipaka, just go through it, nothing significant. Just remember the shloka and just understand the vipaka and which rasa will go into time, which vipaka. Just remember the shlokas also. So karma nirupana, nothing significant in karma. So every drug will has its action. So based on rasa, guna, virya and vipaka, it's called as karma. So just go through the definition. Samyogacha vipagacha karanam dravyamashva kartavyam kriya karma nanyadapekshata charaka sutra. So we are given some shlokas regarding karma. Just remember the shloka and reference of the shloka. Yat kurvante tat karma. Yes. Kriya lakshanam karma. Then comes prabhava. So prabhava is nothing but achintya virya. Okay. So we cannot imagine that this drug will go into do this action. And prabhava will not follow the regular rasaguna virya upaka. It's also called as vichitra pratyarabdha. Achintya shakti. Vichitra pratyarabdha. It is prabhava. So special action of a drug is called as prabhava. It will not follow the natural rule like that of this rasa should attach this virya and this rasa should attach this vipaka and the prabhava is different. So 2 drugs having the same rasaguna vipaka but action is different. The common examples in the classics is Danti and Chitta. Both Danti and Chitraka having the same rasaguna virya and vipaka but the prabhava differs. So Danti is Rechaka, Chitraka is only Dipana Pachana. Chitraka won't do Rechaka, but Danti is Rechaka. Though both the drugs having the same Rasaguna Viryopaka, but Danti is Rechaka and Chitraka is only does the action of Dipana and Pachana. So it also depends on quality and quantity of alkaloids present in a drug.
So rasa also, how much rasa is present. We are just thinking about Madura. The akshana, the quantity of Madura in it, it will vary. For example, everything is carbohydrate source. Banana is also contains carbohydrate, rice is also contains carbohydrate. So wheat flour is also contains carbohydrate. Then how to differentiate this based on glycemic index. So wheat will have a glycemic index of 65, rice will have a glycemic index of 70, so sugar will have a glycemic index of 100. Banana will have a glycemic index of 54. So based on glycemic index, both all these having a mother rasa, but still we are analyzing this with qualitative and quantitative analysis. Glycemic index will varies from each one. So like that, the rasa, guna, virya, vipaka, and the option of it may vary. It's called as prabhava. So just go through the shlokas. So here prabhava again, achara chakrapana is called as achintya shakti. Samana pratyarabdhan, uchitra pratyarabdhan. Similar in dravya and its rasadi physical constituents, but option is different. It's called as Samana Pratyara. In Vichitra Pratyarabdha, so Rasaguna same, but Vipaka is different. Rasaguna Vipaka is similar, it will follow. So Mother Rasa will attain Mother Vipaka, but it has a Ushnavi. So like that is called as Vichitra Pratyarabdha. In PGET, AAPGT, Vichitra Pratyarabdha is most important. So in Govind Parekh, they are given a simple chart, almost one page chart only. They are given some 20 to 24 Vichitra Pratyara of the drugs. They have to memorize these Vichitra Pratyara of the drugs without fail. Okay. So then Prabhava types, Dravya Prabhava, Guna Prabhava, Dravya Guna Prabhava. So Prabhava Pradhanyatva. Okay. Just go through these things. So this one also Shukrala reference is Ashwagandha and Shatavari. Both are Shukrala. Shukra Janaka means spermatogenesis. The one is Shukrala means the quality and Shukra Janaka is quantity. Jivakarushabaka is Shukra Janaka. Shukra Rechaka that will ejaculate the semen, Bruhati. Shukra Stambhaka that will hold the Shukra, Jati Phala. Shukra Shoshaka that will do the Shoshana of Shukra, Haritaki. So Shukra Shodaka, so it will purify the Shukra. It's Ushira. So Shukra Ruddikara, so it will mass production of the Shukra is Masha, Uddu. Okay, Shukra Stuti Karaka, Sankalpam, Shukra Stuti Karaka. So some persons they are telling, I won't get an urge, I won't get a mood, so I cannot ejaculate. So that is the thing. It's Sankalpam Stuti Karaka, Sankalpam Rushya. Shukra Ruddhi Karaka and Shukra Stuti Karaka is Kshira. Rushya is Nagabala and Kapikachu Bija. It's both. Just go through it. We'll share you the material. Vishishta Krimetna Dravya is also mentioned here. So next concept in Dravya one is Viruddha. So already we are going through Agajatantra. So nothing much can be explained with Viruddha. But the question they will ask, a very common question is mixing of Gruta and Madhu. Whether it is a Guna Viruddha, Karma Viruddha, or else ಏನಪ್ಪ ಮಾನ ವಿರುದ್ಧ equal quantity. It's mana viruddha. If add onion with the equal quantity, then only it will act as viruddha. Mana viruddha. So just go through the examples of viruddhas, mana viruddha, guna viruddha, kama viruddha. So and desha, kala, agni, matra. These are also very important in understanding viruddhahara. Okay. So consumption of very common examples in kushta, another disease is consumption of fish along with kshira. It acts as a viruddha. So it will stimulate abhishyanda and the kaphaja vyadhi can come. Okay, so this is the concept of viruddha. Viruddha ahara. You have to understand. You have to counsel the patients. Otherwise, the Nidana Parivarjana concept is having no value. Always we should convince the patient regarding Viruddhahara. So 99% of the patient doesn't know about these Viruddhas. In many recipes, they will add kshira, along with they will add Ushnahara, they will add curd also. So many things Viruddhas they will mix up in the same, and it may be a different, it may give you the good taste, but inside the body it will act as a Viruddha. It will bring the toxins in the body. That will lead to some of the autoimmune diseases. The Viruddha concept should be understood clearly, and we should inquire about the patient detailed food history before prescribing a medicines, before prescribing a patya. Then comes Aushadha Sevanakala. Yesterday we discussed about Aushadha Sevanakala. So according to Charaka, this is 10. So Ashtanga Sangha are 11, Kashyapa 10, Sushruta 10, Ashtanga Hridaya 10, Sharangadhara 5. So in Aushadha Sevanakala, the direct question in APGT they will ask, in Pranavaha Sroto Vyadi, what is the Aushadha Sevanakala? Muhur. In Pranavaha Srotas, we should use Aushadhas Muhur. In case of Udanavata Vikruti, what is the Aushadha Sevanakala? So in case of Annavasrota Vikruti, what is the Aushadha Sevanakala? So in this material, we are given a detail about Aushadha Sevanakala and their doshak predominance. Just follow, just memorize. This Aushadha Sevanakala is most important. You will get 1 or 2 questions from Aushadha Sevanakala. Without fail, you have to memorize. Your very detailed explanation is there with Avagbata, Charaka, and as well as Sharagada. So next comes Anupana. Anupashat Piyate is Anupana. So usually the Anupana will enhance the potency of the drug. It will digest the drug properly, whatever the drug we will consume, and it will make the drug absorption complete. Many a times, Anupana is a launching vehicle, drug launching vehicle. It will reach the drug into the particular target. Okay, so in this concept, Anupana is very important in any of the drug consumption. Sometimes you will advise just only Ushnajala, sometimes Kshira, sometimes some Kashayas. So like that, Anupana is very important. So in your clinical practice, just go through some of the shlokas of Anupana. Best among the Anupana is Mahendra Jal. So rainwater is the best Anupana, and Ushna Jala. Aushadha Snehapana, best Anupana is Ushna Jala. So in Virachana, we are giving an Abhyadi Modaka. So Abhyadi Modaka is the tablet. So for controlling of Abhyadi Modaka and for proper Anulomana, we are giving Abhyarishta as Anupana. Abhyadi Modaka tablets we are giving for Virachana. For control, it is again sheet Ruksha. We are adding some Yeranda Taila to Abhyadi Modaka and along with Abhyarishta. In Snehapana, we are giving a Triphala Gruta as a Snehapana. Anupana, we are giving Ushna Jala. Still, you want to make it more potentified Snehapana, we can add Triphala Kashaya as a Anupana for Snehapana. Then digestion system will be very proper and Sneha absorption also very good. So in this way, we can understand the concept of Anupana. Next, so Dravya Shodhana. So we will give you the list of toxic drugs and their Shodhana procedure. It's there in Agadatra also, same will come. And the procedure in pharmacy, what is Vedana, what is Mardana, what is Devapana. These things were given in the list. Okay. So this is about Dravya part 1. Around 18 pages, 17 to 18 pages notes is there in Dravya part 1st. A4 size notes, 18 page. Okay. So in Dravya part 2, nothing to be explained in the class. So all detailed and non-detailed drugs as my introduction class only we explained. So you should regularly make a notes of this, make a chart of it. So one is the name and some important synonyms, their botanical name, English name, chemical constituent. So important Rogagnata, Doshagnata, important formulation. Okay. So and abhava pratinidhi dravya is one concept is there given by Rajaningan, and multiple names given for a single drug. Madhuka and Madhuka. So Madhuka is Estimado, Madhuka is Madhuka only. Okay. So like that Amruta, Amruta. So multiple names are given, same names will be given for multiple drugs. So Julte Multe Parya in the their calendars. So just go through it also. So this part two Dravya, you should go through it. I will ask you Viva in the next class. So Viva means important things. We'll ask you in the next class after the test. Okay. So next Friday or Thursday we have test on Dravya. Okay. This finishes Dravya. In Dravya, your part is very, very important. So this is the subject having an highest evaporation point. You need to read regularly. So if you're not reading the Dravya, if you forget to read for a 3 to 4 days, you will forget everything. Okay. So the Dravya is most important one for your AAPGT. At least minimum to minimum, you will get 10 marks. Maximum we will get up to 15 to 20 marks. Most of the match the followings, most of the assertion and reasoning questions will come from Dravya. If they want question to be most difficult, they will take question from Dravya. They may ask question through synonym, they may ask question through botanical name, they may ask question through English name. So a lot of things are there in Dravya to make the question difficult. So that's why the very important password to get maximum marks in Dravya is only revision. If you revise it well, if you read it well, then Dravya becomes easier. Okay. So with this, we'll stop today's class. So prepare for the webinar. We'll share you the webinar part 1 notes with you, around 17 to 18 pages. Still some editing is there. We'll edit and send you.